Ladies and gentlemen, please join me in welcoming the speakers, Dr. Naushad Forbes, Dr. Karthik Murlidharan, Dr. Nandini Rangaswami, Dr. Randeep Guleria, and Dr. Shuchin Bajaj. May I request Dr. Forbes to take over the conversation, please?
Good afternoon, everyone, and welcome to this session on building India's human capital. It's a great pleasure to both moderate this session, and it's a particular pleasure given both our key speaker today, Dr. Karthik Murlidharan, and our really distinguished panelists. We will be joined a little later in the session by the Secretary of the Child Welfare Department, who's currently, I'm told, with his minister. So very special and warm welcome to all of you on the dais. Today's topic is of great importance to us all. All of us know that we now have the world's largest population, 1.4 billion plus. We all know that we have a young population, and for at least the next 15 to 20 years, the dependency ratio will move in our favor as a country, in that the proportion of the population that is in the working age will continue to rise for at least the next 15 years or so. And this is a huge potential, as the phrase that's always used, this is a huge potential demographic dividend, but it's a demographic dividend only if we make the best of this young and growing working age population. So how do we provide a population of 1.4 billion with decent quality healthcare? How do we provide a population of 1.4 billion with, my understanding is, the world's largest number of schools by a long way, because as you'll hear, I think, not only do we have a large population, but we also have a very fragmented school system that caters to that very large population. How do we provide our huge population and our huge young population with a decent quality of schooling? And those challenges apply across our federal structure, apply across both union and states playing their role in an effective way, with, at the same time, a very large private system, again of varying quality, from very, very good schools at one end to schools that are much more challenging at the other. So we have this very diverse education system, very diverse health system, diverse in terms of quality, diverse in terms of private and public, diverse in terms of which part of the population they seek to serve. How does this whole wider system deliver? It's a hugely challenging topic. I would argue that if we get it right, we will have a highly secure and prosperous future as a country, because there is no issue that will more decidedly determine our prospects more than the education and health of our population. We're really fortunate to have Karthik Murlidharan with us today. Karthik is one of our leading researchers in, first, the field of education and education quality, what delivers education quality, and he's been doing this for decades. Even, he may not look like it, but he's been doing it for decades. Second, I think he'll mention this, he got from education into other aspects of human capital development and has been working in those areas too. And he's recently put all of his learning of the last 25 years together in a book. It's called Accelerating India's Development. I have a copy here. And it just won the Crossword Best Book Award 2 days ago. So congratulations, Karthik. And as you know, the book is a forbidding size, but it reads really well. It reads really easily, and it reflects actually lots and lots of not only work on Karthik's part, but a lot of editing on his part to make it a coherent, cohesive, easily reading story. So we're delighted to have you with us, Karthik. Karthik's going to start with a presentation. I won't tease him, but Karthik's going to start with a presentation. He'll speak for about 20 minutes, and then we will go to our very distinguished panelists who will comment on how they see education and health and what some of those key challenges are that we need to address in the country. So over to you, Karthik. Thank you.
Thanks, Naushad. Thanks, CII, for putting this event together. I think this is a bit heroic because there's no way I can do this in 20 minutes, right? So what I'm going to do is just give you certain very high-level principles and then a few specific ideas. But the good news is, there is a substantial amount of engagement with senior people in government. So tomorrow, as part of this event, I'm doing a 2-hour workshop with senior officials in the education department. So these ideas have to percolate down the system. So let's start. And I think the context, this session is called Building India's Human Capital. And I think we all understand that it is a critical enabler of getting India to full potential, right? So every East Asian miracle economy that had over 8% growth built high quality mass education systems, okay? So simply put, the Indian model is working well, but we're not firing on all engines, okay? So when you have 50% of kids complete primary school in rural India without being able to read at a second grade level, when you have 35% of children who are stunted, that's just permanently compromising the long-term potential. And so we know that this has to be done. The critical question is how, okay? Now, the challenge is that the default approach by most sectoral advocates is to argue for more spending, okay? So education wallas want 6%, health wallas want 3%, everybody wants more money for their sector, okay? But there are two fundamental challenges with this view. The first is we don't have the money, okay? So fiscally, a lot of these benchmarks of 6% come from OECD benchmarks of tax to GDP ratios of 35%. We are at a tax to GDP ratio of 18%. So the parallel session there is talking about mobilizing resources, okay? So that's exactly the challenge we face. And so we're not going to just spend our way out of this problem, okay? Because if you wait till our tax to GDP ratio gets to that level, we're not going to be there. But the second problem, and this is kind of the key point that we've learned from about 20 years of research, is that a key finding from all the high-quality empirical research in the social sector is that the translation of government as usual, and in fact, my original term was business as usual, and as senior secretary in the government suggested, why don't you call it government as usual? Because that's true, that this translation of spending into outcomes is actually quite weak, okay? So the point is not that we don't need spending, we do need more spending, but it is absolutely critical to improve the quality of expenditure, which is the translation of the spending into the outcomes, okay? And so the core point which, why I wrote this book is that over a 20-year period of working on education, on health, on welfare, on child development, what you see is most of our discourse is at a sectoral level, but the real binding constraints are cross-cutting constraints of governance, okay? And it's really the effectiveness of public systems that we need to focus on before you can actually deliver better. And it's not just about saying sectorally, I'm going to design a new program or create a new scheme. This is going to require kind of really re-engineering and thinking about the functioning of the Indian state. So there have been substantial improvements, and I think the political leadership understands this, which is why in the past decade, I think the areas where you've seen massive progress have to do with DBT and kind of, the entire financial stack. But there's a long way to go in the services that are still intermediated by humans, right? So whether it's education, health, police, courts, these are all human intermediated services. And the second challenge is all of these are state government issues, okay? So you really need to think hard at the state level. So tomorrow I'll also be speaking at the panel with multiple chief secretaries on center state, the road ahead. But the big point here is that the state capacity agenda really is the binding constraint. And so the main reason for writing the book is that a common theme across 20 years of research is that the return on investment on investing in better governance and state effectiveness is often 10 times more than simply increasing the budget, okay? So a different way of saying this is that most of our public discourse focuses on the top line of budget allocation, but not the bottom line of how that budget translates to impact, okay? So if you then look at what intermediates that, it's really the effectiveness of public systems, okay? And so that's why the book is really, it's two halves, okay? And the first half is kind of what it will take to build a more effective Indian state, okay? And at some level, these principles, all of you are from the private sector. This is not rocket science, okay? This is basic management 101, that effective organizations are able to use data for better decision making. They have better personnel management. They allocate their money in, in high ROI activities. They have a viable revenue model. And if you're a global MNC, you need to optimize what you're doing at global headquarters, national headquarters, field headquarters. And the same thing applies in a federal governance structure. And similarly, if you're a company, you need to decide what are you going to make in-house and what are you going to buy externally from the market. And you face exactly those same set of issues in optimizing the functioning of the government itself. Okay, so I'm not going to have time to go through all of that, but I'm going to highlight certain key challenges. Now, the good news in the book is that the reason it's big is that the first half of every chapter outlines a set of systematic challenges, but the second half is then talking about actual implementable solutions, okay? So what I'm going to talk about today is just give you a jhalak, as they say, right? A glimpse of some of these issues, and then I invite you to dive deeper, okay? So the data, I think, again, we have good statistical systems for retrospective data collection, but we don't have them. They're not timely and granular enough to drive kind of decision making. So given improvements in technology, there's a lot we can do on that. Let me just talk about personnel for a moment, okay? So one of the things about the Indian state is what most people don't realize is we are actually one of the most understaffed public sectors in the world, okay? So we often think that we have a big bloated public sector, but relative to the population and in terms of the service delivery requirements, the employees per capita in India are about 1/10 of the Scandinavian countries. And even relative to China, it's about, it's about a third. And so the point is that we actually need a lot more frontline staff. Okay. Now the question is, why do we not have them? It's partly because Indian government employees are among the most overpaid in the world. Okay. And so there's cross-country evidence that shows that the public sector wage premium in India is so high. Now at the very top, that's not true. Okay. Because we have wage compression. But for most government jobs, the government pay is much, much higher. And this is not just a simple problem for state capacity. Okay. One of the general equilibrium points to highlight is how the structure of public sector labor markets also affects the entire economy. Okay, so one of our biggest drivers of unemployment among educated youth is kind of the craze for government jobs. Okay, so we have now studies showing that 80% of unemployed educated youth is because they're writing government exams, okay? And so it's not just about the inefficiency of how you're staffing the government, it's what you're doing to the entire economy, because the reason you're producing students who can take tests and cram exams but not have real world skills is because the most lucrative employer in the economy only cares about exams and not real skills, okay? So that's the tail that wags the dog of the entire education equilibrium, okay? So this is not just about public sector, it's about the entire labor market. Okay, so again, these are things I'm just giving you a glimpse of, but I invite you to go, read the book for all the evidence, all the facts, and how this is all put together. Okay, now a second key conceptual framework in the book, and this is one of the core ideas in the public finance chapter. Okay, so again, in the private sector, no CFO will allow you to spend even 100 crores without doing a discounted cash flow analysis and saying what is the ROI on this investment. Okay, but in government, we don't have that same kind of ability to do these ROI calculations. And we often spend money that doesn't have the highest ROI. Now, you might say, but government is not just about ROI, it's also about equity, it's also about justice. Absolutely, which is why this is a framework that we can use to kind of look at every major public finance expenditure and classify it on this 2x2 axis of equity and efficiency. And the main point I want to make is that reasonable people can disagree about policies in the second and the fourth region, okay, about whether you prioritize equity or efficiency. But what I want to highlight is there are many, many ideas that would improve both equity and efficiency that we are not doing because we are spending so much of our money in ways that are bad for both equity and efficiency, okay? So I'll give you some simple examples in the context of rural welfare, right? What the research shows is a program like NREGA is good for both equity and efficiency because it does a great job targeting the poorest, the landless, and with the work requirement. And it also creates positive demand multipliers in the economy, okay? Conversely, something like free electricity for farmers is bad for both equity and efficiency because the top 5% of landowners get 50% of the subsidies, and that also creates a whole bunch of downstream distortions, okay? So the point is to look at, given a set of objectives, can we achieve those more effectively? And the real free lunch that we have to accelerate development is to improve the quality of our expenditure, okay? So federalism, I think the main point I want to highlight is first principles of federalism would say that service delivery functions should sit with local government because it's the local parents and users who are the necessary constituency who can hold staff accountable. And it turns out, if you look at the data, that India is actually one of the most over-centralized countries in the world, okay? So even a country like China that we think of as highly centralized, over 50% of public spending in China happens at the local government level. In India, that's 3%, okay? Now again, the culprit is not center to state as much as state to local, okay? And so there's a lot more we need to do in thinking in a nuanced way about our decentralization agenda because that's going to affect the governance of service delivery. And then the last point on the state and the market is one of the consequences of weak public service delivery is kind of a mass exit to the private sector, right? So education, 50% market share in urban areas, about 30 in rural areas. Health, the estimates about 60 to 70% of primary care is sought with fee charging private providers. So the subtle point here is that the government plays three very distinct roles in service delivery, right? The government is a policymaker, a regulator, and a provider, right? Now, as a policymaker, the private sector is your ally because you want to deliver for people regardless of who does the delivery. As a regulator, the public and private have to be equal. As a provider, the private is your competition, okay, because you're competing for the same market share. Now, the problem is because 95% of government budgets and personnel are allocated to government as provider, it instinctively often distrusts the private sector, okay? So there is a lot more you can do by kind of thinking, you know, a typical health secretary or education secretary still thinks of their job as running the public health system, okay? But your job is to improve health for the whole country, and often you can do much more by paying attention to making markets work better, okay? So we've got some amazing research that shows how better just disclosure, right, of quality in markets can improve outcomes in both public and private, okay? So there's a lot of evidence-based ideas, but that requires us to have a mindset that we are about making markets work better. And you can also leverage private providers for the poor. But both of these functions also require state capacity, okay? So there is no silver bullet, which is why there's a set of principles here and then a menu of ideas, okay, that we can try. Now, while the problems are difficult, I also want to kind of highlight some very important reasons for optimism, okay? Now, the second half of the book is called Accelerating India's Development, right? And the goal is in picking these 6 sectors of education. So one of the great debates in development is kind of the growth versus development debate, or the Bhagavati Sen debate, right? So should we focus more on growth or should we focus more on human development? By picking these 6 sectors, the beauty is you don't have to choose, okay? Because each of them are important for human development, but each of them is also important for growth, okay? So better education is intrinsically good and it's going to contribute to growth, okay? Now, the point is, how can we be optimistic and accelerate development? And the picture I want to show you is this is one of the great triumphs of development in the second half of the 20th century, okay? And what this is called, it's called shifting of the Preston curve, where the x-axis is GDP per capita, the y-axis is life expectancy, and those two curves are at different points in time, okay? So the lower one is 1930, the upper one is 1960, and by 2015, that has shifted up even further, okay? So what that's telling you is that over time, poor countries are able to deliver much better development outcomes, even at the same level of income, okay? So poverty even at a given level of income, you can deliver much more over time, okay? And the question is how, and the key answer is new technologies, right? Because, you have new technologies that you did not have before. So 100 years ago today, the President of the United States could not save his son from dying from a bacterial infection because there was no antibiotics, okay? So today, that's a routine issue. So the deeper point I want to make is that most acceleration of human progress has come from the creation of new knowledge, from the transmission of that knowledge, and acting on that knowledge, okay? And health is a sector where we have done that quite systematically. But the question is, can you do this for development more broadly, okay? And the key way to ask this question is, what do today's low and middle income countries have that today's high income countries did not have, okay, when they were rich? And the key thing that we have in the last 20 years is much better data and evidence, okay, on the quality of expenditure. So the explosion of microdata, computing power, experimental methods, and this is what was recognized by the Nobel Prize in Economics in 2019, has just dramatically increased the evidence base we have to improve the quality of expenditure. And what that research shows is that many very, very expensive policies and programs have little to no impact, but many very inexpensive ideas are not being scaled, partly because we think we don't have the money, okay? Now, and I want to highlight again the importance of research, okay? As an economist, I don't worry about how private sector companies produce, because you face market prices for inputs and market prices for outputs. If you're not competitive, you'll go out of business, okay? But in the government, you can spend taxpayer money badly for a really long time, okay? So you need to discipline this with evidence. And let me just give you one simple example, okay, of the power of this data. So here's a picture that I consider to be perhaps the most important picture for understanding education in India. And this comes from a large-scale long-term study using computer-aided learning. And it's about 6,000 kids in Rajasthan, okay? And so what this picture is showing on the x-axis is the grade in which the student is enrolled, and the y-axis is the learning level. And if the children are making progress as per the grade standards, they would be on the 45-degree blue line, okay? In practice, the true learning level is about half of that, okay? So the average 8th standard student is at about a 4th standard level of understanding of mathematics, okay? But what is even more important is now with dynamic computer-based learning, I can pinpoint where every child in the sample is, okay? So every dot there is about 10 kids, okay? Now what you see if you look at that 8th standard segment is that in the same class, I have children at a 2nd class level, at a 3rd, at a 4th, at a 5th, all the way up to 8th standard. And why do you have that variation? That is the result of our well-intentioned no detention policy, right? Where we have pushed kids through to higher grades, wanting to keep them in school so that they don't drop out. But the reason you're not able to convert your spending into outcomes is because even a motivated teacher is completing the textbook and the curriculum, and that is so far above where the students are that that's not translating. ஸோ இப்போ இதே லெக்சருக்கு நடுவில் நான் ஒரு வேறு பாஷாவில் பேச ஆரம்பித்தா நீங்கள் நான் எவ்வளோ மோட்டிவேட்டடாக இருந்தாலும் சரி, எவ்வளோ குவாலிஃபைடாக இருந்தாலும் சரி, சின்சியராக கற்றுக் கொடுக்குறேன். ஆனால் எவ்வளோ பேருக்கு புரியறது கொஞ்சம் கை தூக்குங்க பார்க்கலாம். 2, 3, 4, 5 பேருக்கு புரியறது. ஆனால் நான் இப்போ ஏன் பண்ணிட்டுருக்கேன், என்ன பண்ணிட்டுருக்கேன், ஏன்னா எல்லாருக்கும் கொஞ்சம் புரியட்டும் நம்மளுக்கு தினம் ஸ்கூல்ஸில் குழந்தைகளுக்கு எப்படி ஃபீலிங் ஆகுதுன்னு. So what have I just done to you? Okay, I have given you 30 seconds in the shoes of a typical kid in a typical classroom in lakhs of schools around the country. And at that point, it doesn't matter how educated I am, how qualified I am, how motivated I am. I might as well be teaching you in a different language because you're teaching at a different level, okay? Now, the point is that it's because we have the data that we're able to have this kind of insight. Without the data and the research, we would spend money, we would kind of have budgets for programs, build more schools, hire more teachers, and then we'll break our heads as to why is this not translating into impact. And that's because you were not alleviating the binding constraint to the learning, which is that the kids were falling behind really quickly. Okay, so that's just an example. And on the optimistic note, what I want to say is, see, India is doing well, okay? So this is not, so basically if you look at the data, my overall grade of India, like a good professor, is we're a solid B+, okay? Which is, we are average and above average relative to income. But what is it going to take to get to A or A+? So like any good professor, my grade is can do better, okay? So how do you do better? And part of the whole book is a menu of ideas of how you can do better and accelerate this Preston curve, okay? So, and the main point here is that if you go on the current track extrapolating over the last 20 years, okay, that and growing at 6% GDP, you'll still end up at about 25% stunting in 2047. Now, even if you grow at 8%, that number only falls to 22%, okay? But if you can double the effectiveness of spending, then even at 6%, you accelerate that to 17. And that gives you tailwinds that accelerates development because you now have better human development, and that's more likely to get you to 13%. So same in education, which is we have it in our power to kind of get to universal literacy and numeracy in the next 10 years. And why do I focus most of my attention on 0 to 10? It's because the future of these children is yet to be written, okay? So the actions we take now, like is what matters, whereas politically there's often more pressure for youth employment because 18-year-olds vote and children don't vote, okay? But by the time you're 18, it's often too late, okay? So you really want to be starting early and starting with the best data and evidence that you have, okay? So I'm going to be out of time, but what I'm going to do is just put out like 2 or 3 simple ideas, okay, which are kind of evidence-backed. So in schooling, for example, we had this well-intentioned policy of creating a government school in every habitation. Now, this may have improved access, but it's hurt education quality in many, many ways, okay? So it's resulted in lakhs of subscale schools. We have over 4 lakh schools that have less than 50 students and 1 lakh tiny schools, okay, with less than 20 students. And that hurts pedagogy, governance, social integration, and cost effectiveness. It's bad for pedagogy because you have multi-grade teaching of one teacher teaching 5 grades. It's bad for governance because these schools are far away without enough oversight. It's bad for social integration because your communities in rural India are mostly segmented by caste and community. So you don't even get the social integration that you should get with public schooling. And it's also really kind of ineffective cost-wise. So consolidating schools to a minimum size of 150 or 500 can sharply improve school quality. You get better pedagogy, better governance, better social integration, and more cost effectiveness. And it's critical, of course, to provide transport. And what you see is parents are more than willing to send their kids to private schools. They take the buses and go 3-5 kilometers. So there's no reason why they would not do this, okay? Now, of course, the political problem is that nobody wants to shut schools, okay? So my simple idea is instead of closing your existing small-scale SSA schools, you could use that to upgrade the Anganwadis, which are often operating in really ramshackle facilities. So then you rebrand these as upgraded preschools, and then you move the whole system of quality up the chain instead of having this challenge of how do I optimize and also have to shut schools. So that's kind of one idea. There's a whole bunch of ideas. I'm out of time. So let me just talk about one more and just say, this is one of these really, really low-hanging fruit, okay? So early childhood development among the most important stages. So India's policy commitments have been expressed over the last 20 years across governments in several landmark documents, okay? We had an 86th constitutional amendment to do this. It's in the RTE. But the school learning outcomes are still, low, and quality of ECE is weak. So the challenge has never been policy intention. The challenge has been state capacity to implement. So what we did, and the ICDS is the world's largest kind of preschool program that's going to cater to almost 80 million children. We're coming up to 50 years of ICDS, so it's a good moment to reflect and seeing how can we strengthen this and make this better. So as part of this, we worked with the government of Tamil Nadu to do a series of evaluations of different approaches, right? The whole point is you have a limited budget. How are you going to spend this money, okay? So we looked at hiring an extra ECE facilitator. We looked at unconditional pay increases. We looked at supplemental nutrition. Long story short, this is evaluated again with a large-scale randomized control trial published in one of the top journals, and we find that the extra worker was by far the most effective intervention. So having this extra worker focused on preschool education gave you large gains in student learning, substantial reduction in malnutrition, stunting, and underweight because you were freeing up the time of the existing worker to do more work in health. And most importantly, combining kind of economics and social welfare, we estimate, based on global estimates of the long-term returns to these gains, that the return on investment is about 1,200 to 2,000% because it's at 12 to 20 times the cost, okay? Whereas we get no impact of the unconditional pay increase, but that's where most of the money goes, okay? And so again, it reflects the politics of the fact that the existing workers have a stronger voice, and therefore most of the money goes into unconditional salary increases. But if you're able to hire more and keep them local, you're going to get much, much bigger impacts. Now, of course, you can't scale this up overnight, and I think in any ways, this is the lower bound on the effect because the social and economic returns of hiring this extra worker will include female labor force participation, participation, and there's a whole range of other reasons to think this is a great idea. Now, of course, this was Tamil Nadu where things work well. I have no guarantee this is going to work in other parts of the country. So what I would recommend is kind of a gradual phased out scale up, where we test and constantly iterate. But this would be like one of the highest priority things I would do, if you wanted to have cost-effective, evidence-based ideas for how you would do this. And health, we're going to turn over. I'm just going to put the cover and not talk about it, which is we spend over 90%, 94% of our health budgets on curative private health, whereas again, all the evidence shows that investing in preventive public health is going to have you a much, much higher ROI. Okay, so even here we have models like Tamil Nadu has, is the one state that has a really high quality public health cadre. Okay, so if you look at the best performing health states, Kerala and Himachal deliver good health at high cost, whereas Tamil Nadu delivers similar health at a much lower cost. And most expert studies attribute this to the public health cadre. Okay, so GOI has recommended this, but take-up has been low, so I think we can do a lot more. So again, sorry for rushing. This is just like I said, a glimpse. There's a lot more in the book, so happy to engage over time. Thank you.
Thank you very much, Karthik. The bit that I was going to tease him about earlier was I said, look, do not try to summarize 600 pages in 20 minutes. And he did that very well, actually. So anyway, so our first panelist actually is Nandini Rangaswami. Nandini is the chairperson of the GRJ group in Coimbatore, and she runs several schools. So Nandini, you bring a very direct personal experience to the running of schools and schools quality.
Good afternoon, ladies and gentlemen, and distinguished guests on the dais. So this afternoon brings us together to discuss a vision for the future of our nation, a vision that capitalizes on the incredible potential of our young population, as we very popularly call it, our demographic dividend. So our country stands at a pivotal moment, and I'm sure this demographic dividend can be transformed into a formidable force for economic growth and innovation. And central to this transformation is the imperative to build our human capital through a robust focus on education. So as we explore the priorities of school education in India, we aim to shape a skilled, innovative and resilient workforce that is equipped for the challenges of the future. Just a few priorities, key priorities for the Indian school education I'd like to place before you. The first and foremost, I think Karthik has already explained to us about the quality of education in the country today. So this means investing in effective teaching and learning. We need to train our educators to adopt learner-centric methodologies that foster critical thinking, problem solving and creativity. Our curriculum must align with the demands of the 21st century, emphasizing on STEM, digital literacy and socio-economic learning, which is extremely important for the current generation. And moreover, we must ensure that our schools are equipped with the necessary infrastructure and resources, well-equipped classrooms, libraries, laboratories, and access to technology for every student in the country. Inclusivity is paramount. We must provide equal access to quality education for all the students in our country, including those with special needs. There is a divide between students studying in the private sector and the public sector. So this is where I'm saying quality education should be accessible to all students. And we should also shift our assessment and evaluation methods to competency-based assessments that truly measure skills, learning outcomes, and creativity. It is there in many curriculums, especially the national curriculums, but it's not there in some of the state board curriculums. Additionally, incorporating social and emotional intelligence, as we discussed before, into our education will prepare the students for leadership and teamwork in their future endeavors. Next focus should be on skilling and job creation as early as in school education. This involves embedding vocational training into our education system, providing practical job-oriented trainings in many sectors that are out there now, collaborating with industries through apprenticeships like is available in Europe and Australia will bridge skill gaps and provide hands-on learning experiences for our students right from grade 8 onwards. We must foster entrepreneurial thinking by offering education that encourages mentorship and access to resources, ideation for our students in the school level itself. Next would be in this digital age, technology in education is non-negotiable. We need to ensure universal access to digital tools and reliable internet, especially in rural areas. Leveraging AI and EdTech can help us identify learning gaps and provide personalized interventions for each and every student. Collaborating with private entities through public-private partnerships will enable us to build and scale effective digital learning platforms too. Focus is also needed on strengthening early childhood education. Implementing the NEP 2020 effectively will provide universal access to quality pre-primary education. Making foundational literacy and numeracy a national priority ensures that all children attain these skills by grade 3. Lastly, to gauge our progress, I think Karthik's projection showed a lower learning curve for our students in India. So we need to gauge the progress of these students. We must benchmark India's performance in education against international standards. We have very ambitious targets by year 2030, but yet achievable. We are looking at a top 50 rank in the program for international student assessment for reading, math, and science, a place in the top 20 of the trends in international mathematics and science study rankings, and a top 50 rank in the progress in international reading literacy study. So I leave it to you all to ponder over these issues that are existing in our school education system. And as we visualize the future of the education sector in this country, we need to think hard on how we are going to have all these aspects looked into, and all the policy changes that are required at multiple levels need to be put in place. I also recommend a minimum of 6% of our GDP for education. Tailoring programs to address barriers for girls and marginalized groups is also extremely crucial. And one example is expanding the midday meal schemes to support adolescent girls. So we must develop digital platforms to ensure continuity of education and promote reading, writing, and communication in both regional and global languages to enhance employability and global adaptability. So in conclusion, by achieving these decadal priorities, India has the potential to lead the global economy by transforming our education system into a model of inclusivity, innovation, and excellence. I end with a quote by our Honorable Prime Minister, Shri Narendra Modi: "Reform, perform, and transform is the need of the hour." Thank you.
Thank you, Nandini. Our next panelist is Dr. Shuchin Bajaj. He's the founder director of Ujjwala Cygnus Healthcare, and I think he's going to talk about prevention in healthcare, which ties in directly with Karthik's point earlier on.
Thank you very much. Good afternoon, everyone. It is an honor for me today to address you as we discuss the critical topic of human development, human capital development here. I've attended a couple of other sessions as well, and as we gather here to speak about economy and the rising markets, artificial intelligence, machine learning, GDP, trillions and billions of dollars, unfortunately, a vast majority seems to slip below all safety nets that we are trying to create for them. And in India, we're speaking about more than 300 million people who do not have access to high quality healthcare, especially in situations where the golden hour and emergency is of critical importance. This divide, this unequal facilities that we have in our country is an unfortunate reality for us. And it is not just in healthcare, it is in all sectors. On the one hand, we are sending, moon launchers and Mars rovers, but on the other hand, we struggle to provide good quality public transport to our communities. On the one hand, we have gated condominiums, but on the other, we have slums sprawling out as far as the eye can see. And healthcare is no different. On the one hand, we have the highest quality hospitals and healthcare providers, the best doctors the world can offer. But on the other hand, we struggle to provide even basic primary preventive care to most communities. This divide is not just unjust, it is quite unsustainable. At our healthcare group, Ujala Cygnus, we've always strived to provide the highest quality, most affordable healthcare to communities that do not have access. And this work has taught me one vital truth. Human capital is the most valuable asset a country can have. And it must be nurtured through strong investments in healthcare as well as education. Primary and preventive healthcare is the bedrock of this, right? Because the costs of curative healthcare are prohibitive. And as Karthik said, we cannot really afford costs at the level of the OECD countries that everyone aims to ask for, right? As he said, health wallas will always seek 3%, the education wallas will always seek 6%. But where do we have the money to offer that? And unfortunately, we do not estimate the cost of the disease correctly as well. We are just looking at the direct cost of the disease in most surveys. So India, as we all know, is the diabetes capital of the world. We have 100 million diabetics almost in the country. And we know 30% of them will end up into kidney failure. We are amputating one foot almost every 5 minutes due to diabetes complications. So if a poor person develops kidney failure, develops gangrene of the foot and comes to us, we can maybe congratulate ourselves and pat ourselves on our back that, oh, we'll treat you for free because we are champions of Ayushman Bharat. The government has given this wonderful scheme which we are championing as well. If you had gone to the big city hospital, you would have spent 2-3 lakh rupees on this. But is this really the cost of the disease? The cost of the disease is much higher. Because now he doesn't have a leg, because he is in dialysis twice a week, he cannot really go back to the factory or the fields that he was working in. So his future earnings that are lost run into lakhs and lakhs of rupees. But the scariest cost is the intangible cost of the disease. Because he is now out of a job, he will pull his children out of school and start sending them to work. So many future generations will be destroyed because we could not detect the diabetes in time, because we could not prevent the complications, we could not control the diabetes in time. So primary and preventive healthcare, I think, is the bedrock of all human capital development that we are trying to work on. A sick economy cannot be a fast growing economy. If we are aiming for a $5 trillion economy, we have to make sure that the communities that we are working with are healthy, are having good healthcare seeking behavior, are aware of what their health issues are, and go and access healthcare at the right time, not too late. Going to a curative tertiary care hospital, even if it's free of cost at the point of delivery, is ultimately too costly for us as a community, as a nation. We must rely very strongly on technology to drive this. I agree that technology may sound further from us right now in healthcare than in most other sectors, but I think we are at a cusp of technological revolution. If we can carry preventive healthcare to the villages, it's not too far when we can carry it inside their homes. Getting wearable devices, making sure we are following their health in real time, detecting diseases in time, and making sure that we can prevent the complications early on will go a long way in saving costs for us. This can only be done through partnerships. Alone we can do very little, but as partners, government policies can set the stage, but the ingenuity and eligibility of the private sector to go fast and go quick, and the grassroots needs of the civil society organizations, the penetration that they have. I think if all of us come together, then we will be able to do much more than we can do alone just in the government or just in the private sector. Finally, we must make healthcare a movement, not just a service. Health is not just the absence of disease, it is the foundation of productivity, creativity, and growth. By ensuring equitable access to healthcare, we will not just save lives, we will create a workforce that will build the India of tomorrow. I want to leave you with a vision where a child in a remote village has the same chance at life as a child in a metropolitan city. An India where healthcare and education are not privileges but rights. And an India where our human capital, 1.4 billion of us, is the driving force behind our success as a developed nation. This is not just a vision, it is a responsibility that all of us have to carry out together. Thank you very much.
Thank you, Shuchin. I think we all share your wish. Our next speaker is Dr. Randeep Guleria. Randeep is the chair of internal medicine at Medanta, but I think we all actually know you, Randeep, as a very safe pair of hands all through the pandemic when you were the director of AIIMS. And I think all of us really received great reassurance of how things were actually being handled and what we needed to do from a health perspective at a very critical time. So thank you for all of that.
Thank you for your kind words, sir, and good afternoon, ladies and gentlemen. To begin with, I would really echo what Shuchin said in terms of the health sector and the need to focus on preventive health. And the reason why I feel this is more important is because there is a paradigm shift as far as health is concerned in our country. From an era where we were having a huge burden of disease which was basically because of communicable diseases, India has shifted significantly, and the burden of disease is now more towards non-communicable diseases. We have had outbreaks and pandemics, but if you look at the data that is there, the burden of disease now is more towards chronic diseases, cancers, heart diseases, diabetes, chronic respiratory diseases, chronic diseases, whereas maybe 20, 30 years ago we were fighting malaria, tuberculosis, infant mortality was high, mother and child diseases were much higher. So as the paradigm shift has happened in the burden of disease, these are diseases where preventive health becomes even more important, because chronic illnesses that now are happening are illnesses for life. So you could treat malaria and the patient could go by, but if you have a person with hypertension or diabetes, he needs treatment throughout his life, and you need to worry about end organ damage, which can actually impair the quality of life. So I think it's very important for us to understand that as health has changed, our needs change as far as the health system is concerned. Also, although we have a huge population, the need of the population is also very high. We need an additional 3 million beds. We need additional 4 million healthcare workers as far as the WHO data is concerned. And we need to understand that this distribution continues to be uneven. We have a lot of or a high density of healthcare workers, doctors in tier 1 cities, but as we go to smaller and smaller towns, there is actually an absence of healthcare workers, and that's why you have a lot of people who are not properly trained actually managing healthcare in villages in rural India. So that is a stark reality which we need to understand. How does the system work in India? I think let's first look at that quickly before I give what I think we could do. We have the government-funded system and we have the private system. The government-funded system looks after the vulnerable population, the lower socioeconomic status, and it's supposed to also look at various other programs, whether it be the vaccination program, whether it be screening, or whether it be various other programs in terms of surveillance. The system is grossly underfunded and has poor infrastructure as far as one can see over the last 2 or 3 decades. And that's because healthcare, like I said, not only it has changed in terms of the burden of disease, it's changed dramatically in terms of how healthcare is perceived. So let's say 30 years ago when I was, let's say, a resident, health was something where investment was not that much. You just needed to have a hospital, you had beds. You just needed an X-ray, you didn't have things like an ultrasound, CT, MRI or a PET scan. ICU just had a simple monitor, you didn't have high-class monitoring. But all that changed in the last 2 or 3 decades when technology moved rapidly into healthcare. You started having better diagnostic facilities, you started having better ways of monitoring people, but that also came with the cost, and therefore the cost of healthcare became much more, both in terms of investigation and in terms of providing health facilities in terms of hospitals. That actually changed the whole paradigm in terms of investment, because we moved from an era of clinical medicine to an era of investigative medicine. You would go to a doctor in the past and he would examine you in detail and give you a prescription and you would start your treatment. Today you would go to a doctor and he would give you a list of investigations that you need to get done first before he starts you on treatment. And that is why I think we need to understand that there has to be more and more investment in healthcare because of this paradigm shift which has happened. And that has led to the government sector not being properly funded, decreased infrastructure, and obviously not proper accountability and optimal use of the facilities in the government sector. A lot of frustration has occurred in doctors and healthcare workers in this area, and that's why there is as was mentioned also, there's a mass exit of doctors from the public sector towards the private sector. The other side of the story is the for-profit private sector. That has done well, that has started booming. We have a whole issue of medical tourism doing very well in our country. But this has led to increasing out-of-pocket expenditure. And as Shuchin mentioned, a large number of people actually, it's not only the individual who has to pay for it, the family has to pay for it when it comes to the expenditure as far as healthcare is concerned. And therefore, I think this is something that we need to understand and address and see how can we find a solution if we want to have a vibrant India which is healthy and where the quality of life is provided to every citizen irrespective of where he is staying or what is his socioeconomic status. And I think there are a few things that one needs to look at. We have a good private sector, but it has its flaws. We have a public sector which is not functioning that well. There is a need to see how we can develop a good public-private partnership where you can look at how can we also use this partnership for training allied workers, training other staff so that they can enter the system as far as healthcare is concerned and be able to provide at least some degree of health to even rural India, which is of good quality. We need to see how can we optimize spending in terms of optimal use of our resources with accountability. How can we look at the whole paradigm shift that we may have in terms of better use of our resources, combining what is available in the public sector and what is available in the private sector. And I think India is one country where we need to look at frugal innovation. How can we innovate in a way that we can make healthcare more cost effective? We use a term in North India which says you do a jugaad, that you do something that you try and find a way out by. So we need to look at various jugaads that we can do as far as the health system is concerned which can make it cost effective. Because the cost of healthcare currently is really very, very high. And I do feel that when we look at the health system, because of change that is happening, technology coming in, more and more ways of being able to monitor patients better, more and more ways of being able to reach out to patients because of tele-education and telehealth, there is a need for us to really adopt and adapt to the changing technology which is coming in. And that needs to be built into the medical curriculum itself. So there is also a need to look at how we can improve our medical education with changing times. And at the end, I think there is a need for us to develop partnerships between policymakers, public sector functioning, private sector functionings, and of course, patients who are the consumers. Everything that you do has to be patient-centric. If we are able to really involve them, then I think there is something that we can do. And I do agree that there is a need to look at a public health cadre for the whole country. It's something that is really needed. And ultimately, what is needed is, as was said by the government, that we need to help a policy that we can say to the world that we can heal in India and we can heal by India. Thank you very much.
Thank you, Randeep. Our last panelist is Shri Anil Malik. He is the Secretary of the Ministry of Women and Child Development.
Thank you so much. Good afternoon, ladies and gentlemen. So I am going to talk about this topic, what my ministry is doing about, developing human potential, human resources of the country. There is a presentation, if I can move it. Yeah. So we basically are running 3 big missions, mission mode programs in our ministry, about 15 odd schemes. We deal with basically children up to 6 years of age and expecting ladies and young mothers and adolescent girls also. So the idea is that since conception, when the child is conceived and then when he's born, up to 6 years when the mental development is more or less done, brain is developed by that time, the health of the child as well as the lady who is expecting or who delivers, that is maintained. So, we have a healthy generation. So, these are just figures. We are everywhere in the country, about 1.4 million Anganwadis spread across the country. And these are the objectives of the mission, like development of human capital. Nutrition is one topic that we deal with big time. And many of us think, we know nutrition. We eat food 4, 5, 6 times a day. But I'm not sure any of us really or many of us really know, what is the meaning of real good nutrition for the body, or we maintain that kind of nutrition. We just have to learn from, the good top athletes in the world, what they eat, how they eat, and what they don't eat. So, and then you realize, there are so many bad things that we do with our liver and body every day. So, we deal with this issue big time, and our schemes are barrier-free, entry-free. Anybody can come, any beneficiary can join. There is a legal obligation also that, we have to provide the difference between the recommended dietary allowance and also the average daily allowance that is available to many, relatively lower income groups. We also deal with the early childhood care and education. I think we were talking about it, so I'll just put some, words about that also. This is the basic nutrition program through take-home ration as well as hot cooked meal that is provided in the Anganwadis, and take-home rations, dry rations are provided to the beneficiaries. We have revised the nutritional standards last year, made them more comprehensive, and we are also going to look into the quality of the rations and the food big time. There is a lot of institutional change that is happening. Not moving. Okay. As I said, we have several schemes for the expecting lady or the young mother. These are the schemes listed out. Health Ministry is also there. So multiple schemes. There are no entry barriers and cash transfers happen. This Matru Vandana Yojana, more than 2,000 crores has been transferred to about 4 crore ladies till now. So it's some money. For adolescent girls, we have nutrition as well as health education and skilling also. We are now entering into the skilling arrangement with the MSDE, and about 2 million adolescent girls across the country in about 220 odd districts we have. So we are going to train them also in non-traditional occupations so that they become more empowered and they can take their own decisions later on. I think you spoke about this. You said Anganwadi, the infrastructure is not good. Yes, infrastructure in many Anganwadi is not good, but we are going to upgrade them, over a period of time and make them really, good centers of nutrition and early childhood education. So we are investing big amount of money. Right now, about 200,000 Anganwadis are going to be upgraded, and then in next few years, we are going to take the rest of them. So all these things will be added. They'll, be practically at par with good schools. This is the early childhood education program that we are running. This is the 2 basic documents we have, Aadhaar Shila and now Chetna. We have uploaded them on our online system. Actually, we don't do anything on papers. You will not believe, but we actually are doing it. All our Anganwadis are digitally linked across the country to the states and to us. We are digitally linked with them, real-time basis, every day, day after day. So all these things are uploaded on the online platforms. We are training the Anganwadi workers in this joyful play-based learning, so that the child is ready for the school after he clears the Anganwadi part by the time he is 6. This is what I was talking about, the tracker. We have a big IT system where it's a big technical aid for the worker. She has a smartphone, and it is available in local languages. She can communicate, we can communicate to her and get things done. She uploads data of the Anganwadi every day on the tracker, where instead of any survey or any episodical random survey, etc., our survey happens every day. There is a dynamic identification of the nourishment indicators, and as per the WHO standards, auto calculation of the nutritional status of the child and the lady, that happens. And of course, it's a good one for the decision makers. This is a comparison like pre-tracker and post-tracker. Obviously, all IT systems have huge advantages. So all those advantages are available. Now there is, auto-generated reports and all those things. The files and the records are out. They are maintained automatically in the system. Auto scheduler is there, like Anganwadi worker has to visit some homes, the home of a expecting lady, or there is a malnourished child in the Anganwadi. She visits the home for special, talk with the family, or other, visits with the ASHA worker, A&M. So all these things happen now as per the schedule charted through the digital system. So, these are the advantages of the system. It has really made our life very simple, and our decision making also very simple, and has made monitoring and supervising almost 1.5 million Anganwadis rather easy now, and it can be done sitting in offices from distances. I think we need to look at these indicators. The first 5 are the NFHS indicators about children 0 to 6 years. Some of them are 0 to 4, 0 to 5 years also. There is progress, no doubt, since last about 30, 32 years. There is no doubt there is progress where the numbers have actually increased. Now we have about 90 million children with us. So this is the data, the last 2 lines of the tracker. But couple of things we need to really look at: why stunting is not coming down the way it should, and why there is so much difference between the figures of wasted percentage as given in the NFHS 5 and our figures. So we need to really look at that. We are doing that. This is our mission for the ladies, where the helplines and the stop centers and all these schemes are there. They are relatively new schemes. Helplines are also relatively new. So now it's like, in times to come, we may have like something like 911. Practically we have those 2-3 helplines. They are all integrated with each other. The help can come very easy now, 20-30 minutes maximum. The average time is about 20 minutes. You need police resources, ambulance or whatever, to the woman or to the child. Okay, various schemes. I would like to just highlight the Sakhi Niwas, the working women's hostel. This year, Government of India has committed 5,000 crores for constructing hostels across the country, about 1,000 of them. And we are also going to utilize a lot of private sector investment. I'll just go back, I think this one, yeah. This is for the children. Obviously, we don't see those children except as beggars, etc. There are lot of children who need our protection. So state is there, state is looking after them. Children who need care and protection. Sometimes children also get involved in legal issues. So we are running this scheme also across the country. About 200,000 children we are looking after right now. I'll just tell you about the last one. So This is for 5 years. Our budget is, it's not that the funds are a big issue. It's just that the quality of use of funds, the proper project management, that is an issue that we need to fix. You can see now the states and the center, they are spending 213,000 across 5 years. It's more than 42,000 crores per year. It's a lot of money. So this is what I wanted to present, that for human development of children and young mothers and young girls, this much money we are putting in different schemes of nutrition, health, and we think that the children born today, they'll be leading India into 2047 when the Honorable Prime Minister has given a clarion call that we have to develop this country by that time. So we are very sure that the challenges that we have right now in terms of malnutrition, etc., we are going to overcome, and we'll have very good health and nutritional indicators. I thank the Finance Ministry and the CII for this opportunity, and you guys for patient hearing. Thank you so much.
Thank you. Thank you very much, Mr. Malik. Thank you. We have a short amount of time for questions, so I'm going to skip my questions and come straight to the audience. What I'm going to just a second. What I'm going to do is to just take 3 questions and then come back to the panel. And I'll take all 3 together. One ground rule: it needs to be a question, not a comment. If you have a comment, we'll have the discussion after the session outside. So question, please. And second, if you can keep it very brief so that we can get the 3 questions and then get responses from our panel. So I'll come first in front right here, and then I'd like to go somewhere at the back, actually. So right in the corner there, the lady sitting at the back who had her hand up, and we'll go to the back there if that's okay. Yeah? Thank you. Okay. Go ahead. Yeah.
Good afternoon, everyone. Thank you for the insightful session. I think young people like us are the human capitals. So we are very proud of that, first and foremost, and thank you for the insightful session. My question is, if we can summarize in 30 seconds, what is the first thing we can do to improve the human capital? Means, what is the lowest of hanging fruits we have to improve that? I think that would be the better start.
That's a nice question for all our panelists. Thank you. Yeah, go to the back there.
Good evening. Thank you so much for giving me opportunity to ask the question. My question goes to Nandini Madam. This is regarding the early child care and early education. She talked about the importance of AI, importance of critical thinking, importance of everything. Other than that, I feel that moral education in today's time, I feel that we should give impetus on moral education from the very early childhood education, which was there earlier, but I don't know in the current...
Your question is?
The importance of moral education. Are we integrating?
Moral education. Okay.
Yeah.
Thank you. Okay, back there.
There was no mention
sorry, it was actually the other gentleman behind you at the back. No? Okay, go ahead, please. Yeah.
There was no mention of artificial intelligence in solving India's health and education problem. What we heard a lot, artificial intelligence will bring major revolution in health and in education also. Any reason for skipping that subject? Thank you.
Okay. So what I'm going to do is I'm going to use my privilege as the speaker to give Ashank a question, because he had a question, and he's a good friend, and otherwise he'll give me lots of grief.
Yeah. You should better allow me to ask questions.
Yeah.
So on a serious side, thanks for analysis, practical wisdom from people in field and government's fields, which I also didn't know many of them. My question is, to you maybe, but to everyone, is you talked about saying that it is not about as much as spending money, but about efficiency of delivery and so on. Can we look this another dimension to it? It is not about total spend in education and total spend in health, but the proportion that is spent between primary, secondary and health, tertiary, or primary health, secondary health and tertiary health, primary education, secondary and higher education. So do we have any data on the proportion that is being spent country-wise? You gave a lot of data on China and others, which is interesting. Do we have a proportion? So my hypothesis is it's not about total spend, but proportion.
Okay, proportions for spending on health. Health, particular health and education.
Primary versus tertiary, primary versus tertiary.
Education. We'll maybe focus on education, Karthik, and I'll come to you last for that. Yeah. So let me start with the first question, and for that I'm going to request a very quick answer from any of our panelists, even all of our panelists, that if you can do only one thing to enhance human capital that you feel is the lowest hanging fruit, what would that one thing be? Okay, so anyone who wishes to go first. You'll take the second question, Nandini. Thank you. Yeah. Would you like to go first? Would you like? Just speak. I think just speak.
Okay, like for me, it is like we have about 100 million beneficiaries coming to our institutions, especially Anganwadis. I wish about 40-50 million more who are out of it. They know that there is an Anganwadi and the services, but somehow, you know, they, because of various reasons, don't visit, don't come, and a lot of damage happens, you know, about health and nutrition. I wish, you know, we are able to attract them and, you know, bring them in our food. So this is very simple, doable thing, no extra funds really, you know, just a little more effort, maybe more awareness, maybe, you know, something else, maybe more IEC. So I wish that happens.
Thank you, Mr. Malik. That's a great wish. Thank you.
Since you had
Shuchin?
asked for it
Yeah.
in 30 seconds, I'll give it to you
Yeah.
very quickly. I feel primary and preventive healthcare, as I talked about, I'll supplement it with an example. A colleague of mine who I travel with a lot, he takes me to all the hospitals, you know, we drive together. So he tells me that when he was young, till 6th standard, he used to come first in mathematics and races. These were the two things that he used to really excel at in school. And suddenly his father died. And then his mother said that now somebody has to start earning. So she pulled him out of school and now he's driving a car and doing odd jobs and everything. So luckily my father survived, right? He used to make kites for a living in his early days. He survived and he forced me at peril of death to study, right? If he had died early, I may not be sitting here and I may be making kites right now. So human capital, it's very important for you to stay healthy. If you're alive only, then will you contribute anything to the economy, right?
Randeep? Yeah.
So I think I'd agree with that, preventive health, but I think also affordable health. The challenge that we have in our country is that there is a huge diversity. How can we bridge that gap in terms of being able to provide affordable health to everyone so that it's of good quality and no one is sort of left behind?
Karthik, if you can do yours at the end,
at the end of
when I come to question 4, yeah, from Ashok. So, Nandini, would you
Yes,
like to take the second question?
The
then?
answer to the lady who asked me the question on
On
the
moral
primary
teaching, yeah,
and
yeah.
yes, primary education. I didn't talk about technology intervention in primary education. What I meant was the NEP clearly gives us a lot of insights into how the quality of pre-primary education can be very foundational and like how the children can have literacy and numeracy being taught at that level. So what I meant by technology is at the higher classes where of course technology is come to stay whether we like it or not. So harnessing technology for the other classes, the higher classes, using digital tools and especially leveraging the EdTech and artificial intelligence is very important. That's what I meant.
Okay. There was a question on the role of AI on health and education. I think that's a whole session, if not conference. So, Randeep, would you like to have
So
a
I
quick
think
shot?
I do agree AI is going to play a big role in terms of how medicine is going to be practiced in the future and in terms of whether it be radiology, pathology, or even dermatology or various other branches. It's already coming in, but that doesn't take the need for physicians away from the day-to-day practice. So balance between the science and art of medicine is, I think, equally important.
Thank you. We did a session in our company where we got 2 doctors to speak to us who had a lot of experience. And they talked about the importance of combining clinical and investigative. And that it's not one or the other, but both that leads to good medicinal outcomes. So yeah, thank you. Karthik, last word for you. And if you can address both the one thing and the point on the proportions, or in whichever order you'd like.
Yeah, I think, see, the most important overarching point I want to make is the centrality of cost effectiveness in how we think about these sectors, right? Because I think in the social sector, there's often the sense that the people in finance are bean counters and don't want to spend, okay? But the thing is, in a world of constrained resources, cost effectiveness is a moral imperative, okay? It's not just something that the finance and account people have to think about. So in a world, in a room, if you put 20 people, you'll get 20 different ideas, okay? So the question is, what do you do? And in practice, what happens in a lot of policy documents is you have subcommittees and everybody puts their recommendations, and then we list everything, and then we'll give a little bit of money to everything, okay? Because you want to show that you've done a bit of everything, but you're not actually delivering on the most cost-effective things, okay? So I think there's an overarching principle here about putting cost effectiveness at the core of how we think about prioritization, and that relates to, I think, a variety of things. So if you were to say one thing, so today, based on the evidence, I would say, I don't think it's enough to say focus on preventive or focus on EC. I think we need details. The details really matter, okay? So, for example, government of Indonesia passed a constitutional amendment to spend 20% of their budget on education, but then all of that money went into unconditional increases in teacher salaries, okay? And we found that that had zero impact, okay? So it's not just about sectoral spending. The details really matter, okay? So right now, I would say based on the evidence, the thing I would be most confident about wanting to pilot seriously to expand is the second worker in the Anganwadis, so that you have somebody focused on early childhood education, so that somebody else can focus on the nutrition, the maternal visits, the counseling, and the evidence suggests that the returns are very, very big. Now, I don't think we have enough evidence to scale it nationwide, but a phased approach saying identify the most challenged areas, like where we have the biggest challenges, at least start there, and then start by doing some evaluations. I think that's what I would do. I think on AI, my simple point, I mean, there obviously wasn't time to cover everything, but if you notice one of the things I mentioned in that slide about shifting the person curve, it is about kind of creation of new knowledge, correct? So that AI is part of that process by which we create new knowledge. But I think it's also important to understand that if you look at Nobel Prize winner Angus Deaton's work, right, what he shows is that the issue is not the innovation. The issue is really building the public systems to get the benefit of the innovation to those who can't afford to pay. So the market will do innovation at the right tail of the income distribution, because all the innovation happens where there is purchasing power, and then you need governments and public systems to take that to scale, which is why most of what I focused on was how do you build more effective public systems, because that's what it takes to solve these problems at scale.
Thank you, Karthik. We're right out of time, so we'll need to end the session here. I just wanted to end with one comment, which is, it's the answer to the question of how do you eat an elephant? Right? And the answer to the question is one spoonful at a time. And building India's human capital for the long term is that kind of challenge. It's a huge challenge. But we need to start with a granular approach. And I think the point that you made just now, Karthik, first of that granular approach being instructed by good research, being clear what the potential good outcomes are, and then not assuming that those outcomes will work wonderfully everywhere on the basis of what we've studied, but to iterate and try something out, and on the basis of the actual experience, expand it, and if the actual experience continues to be really good, expand it even more. And so words like wisdom, words like experimentation, words like using research as a basis for policy and going ahead on a granular delivery with a focus on both good design and good delivery built into the design as a way of approaching these elephant-sized problems. So thank you all very much for being here. Thank you to our wonderful panel. And let's continue the conversation.
Thank you. And may I request Dr. Forbes to present a token of appreciation to the speakers, please.
you very much.
And may I request Ms. Soma Banerjee, Deputy Director General, CII, to present the appreciation token to Dr. Forbes. Would request the speakers once to step forward for a photo op. Thank you very much, ladies and gentlemen. With this, we are closing this session. You may remain seated for the next session, From India to the World, the GCC Revolution, which will begin immediately. Ladies and gentlemen, we'll begin the next session. Would request you all to please remain seated. Ladies and gentlemen, please join me in welcoming the speakers for the next session, From India to the World, the GCC Revolution. Please join me in inviting Mr. Hitendra Dave, Mr. Tanay Kediyal, Mr. Kaustubh Kulkarni, and Mr. Mark Taylor.
Good afternoon, everyone. I know it's been one session after the other, and many people have drifted out of this room. Hopefully, we will make the conversation such that the people who have chosen to leave will regret later on. And those ones who have stayed back, hopefully, will remember this conversation for a long, long time. My name is Hitendra Dave. I'm with HSBC India. And it's my great pleasure and privilege, actually, to have such phenomenal panelists or members of this panel discussion. To my left, Mr. Mark Taylor, who's the Vice President of Global Strategic Growth for Oracle. Welcome, Mark. To my right, I have Mr. Tanay Kediyal. He's the Managing Director of Allstate India. And to the extreme left, we have the one and only Mr. Kaustubh Kulkarni. He's the Senior Country Officer India and Chairman Asia Pacific for JP Morgan. My plan is to speak for a few minutes just to set some context, and then really it's about these people who know this area much, much better and much more. Okay, you know, there are 17 sessions lined up by CII between today and tomorrow, and yet we are discussing a very specific topic called GCCs, Global Capability Centers. So why exactly that is, I'm just trying to set the context, and then we will get into a Q&A, and hopefully there will be some questions from the audience towards the end. So I've just made some notes for myself. So you know, like, no, it's not 17. We have 22 sessions spanning a very broad set of topics. So let me start by contextualizing why CII has prioritized this discussion on GCCs over other more usual topics. So just for the benefit of everyone, because I know we have many people here who are part of the GCC ecosystem, but those that aren't, the export revenues of GCCs is expected to touch $100 billion by 2030. Okay, now think about it. We've been selling goods forever and ever and ever, and that might get to 600 or 700 or 800 billion dollars by 2030. So it's already a seventh or eighth of that. 5-6 years back, the term GCC itself was not known to too many people. Now it's frequently mentioned in newspapers. It's along with startups, GCC is the most commonly used term for those interested. Just apart from the $100 billion of exports and the fact that it's now becoming a more and more mainstream topic, it employs about 4.5 million people, and it's 4.5 highly paid, highly skilled, highly educated people. The kind of employment practice India really wants to showcase to the world. This export numbers, the employees has created effectively new cities. What Hyderabad of today is almost entirely due to GCCs. The Bangalore of today is vastly different to even the Bangalore of just 10 years back due to GCCs. NCR, Pune, name it, Chennai. So it has profound implications. That's why we are discussing this topic, that it's built cities, it's built real estate, it's built industries and employment away from just the GCC linked one. Restaurants are getting created, pubs, malls, you name it, the modern Indian city is getting created, and GCCs have played a very big role in that. Obviously at a macro level, we know all of us have India has a trade gap, and GCCs are helping us offset that trade gap. So it helps with external sector stability, currency stability, etc., etc. I think a thing which is often perhaps not appreciated is the fact that the GCCs, with their hundreds of thousands of highly paid, not highly paid is not the right word, highly skilled people, is embedding India deeply into Fortune 500 companies, right? A lot of Fortune 500 boards and CEOs know more about India because of the GCCs they have in India than because of the size of their market here. So, and that has implications, right? The people come here, the boards come here, the executive managements come here, they look at the country, they see the opportunity, then they go back, can we do more than just the GCC here? So that is the broad background, right? So now let me turn to this amazing panel that I have, which comprises of 2 people who are running GCCs or part of the GCC management teams, and one very senior banker who competes with HSBC and other banks to serve the GCCs, right? So let me start with you, Tanay, who runs, as I mentioned, the All State India GCC, and thereafter to you, Mark. Maybe some comments on your experience and evolution in India. And thereafter, if I can also ask you to comment on what the country, we've seen it's done wonderful things in India, but India's needs are also humongously large, right? So what does the country and its states need to do to sustain the growth momentum of this wonderful new industry that we have discovered? Over to you.
Thank you. And it's a double-barreled question, so I'll have to keep a track. But in terms of competition, Hitendra, we are a loyal HSBC customer, so we are on the same side as how I... But to the GCC journey, and I have been in this journey for the last 25, 26 years across 3 different organizations, across 2 different countries, having experienced this, and a lot has changed. If I really look at it, I know you were talking about GCC and startups competing. I think Gen AI and AI is the other word that's taking a lot of airtime. And if anything can compete Gen AI and AI, it is GCC in that form and shape. When it started, and I'm talking about late 90s, from that point to today, it was even not known as a GCC, but was known as a captive. And always made you feel as if your hands are tied and you're kind of put into a corner somewhere. From that point to today, that appreciation has changed, not just with cost arbitrage being a thought for which most of the other organizations would have thought, but talent being the key play, and that really bringing about a change. As a country, and not just for GCCs, but as a country, we have always been great exporters of talent. And not just in the industry that I am in, but across industries, across a lot of senior leadership in the world, we do see Indian talent going in. So what better than being able to be within the country to be able to do that? The last 3-4 years, I think, and I get rapped on my knuckle by my 21 years old when I say that pandemic in some senses was good. It was never good. But from a GCC perspective, it really provided the world a chance to see that everybody's on the same platform. And it gave a chance to see that you could do any job from anywhere across the globe in the virtual world that we exist. And that has seen the GCCs really ramp up and notch up, building out capabilities, building out functions that never in the past we could really have been imagining. There is that perception, it's an army of people who continue to do a lot of processing work, and that's true. We are 40%, and I come from the banking, financial services, and insurance space. 40% of the globe's transactions run through India in some form or the other. And when I'm talking about that, I'm not talking about what's at the data center, but just us touching it in some form and shape. All of us talk about make in India in the manufacturing context, but the GCCs have been make in India for a lot of financial instrument connections that we have been doing. We built resiliency like anybody's business, and this is a scenario that would not happen. But if for God-forsaken chance, India was to come to a grinding halt for 6 hours, the global market would come down for 6 hours. And if it was shut for 6 days, I'm sure across the globe there would be a lot of conversation happening in the wrong sense. That's the criticality of the work that is happening out of this industry. And to add to it, not just that piece, even in terms of innovation, no more is that thought that innovation is coming from a talent that has moved from India to a global site, but really that innovation coming out of the India site. I'm sure all of us have heard those regular examples of Google Tej, that becoming Google Pay, or other similar things that across industries have been bringing in. If I speak for ourselves, and if I speak for how Allstate has been using, and like I said, GenAI is the most competing word, in the way technology has been able to change how we do insurance, in terms of the digital way, and I think in 3 different ways. Most talked about is efficiency, but for customer experience and for the digital journey, a lot of that innovation we are able to bring because both technology and the business processing are under the same roof, so to speak. We have been in the country for 12 years, but there have been others who have been much longer. I know HSBC and JP Morgan both. But to me, for somebody coming in this journey, it's a generational shift. Most of us end up talking 500 people over 3 years and then grow to a scale and then become a value center. I think the opportunity today is to jump all these generations and just start from that point where you are truly a global capability center. But for more and more of us who are coming in here, it's also a question of saying, how do we have that infrastructure? How do we have that access to talent? How do we really work with large education institutes to prepare the workforce to be ready from day one? And how do we really work well with the government to truly become a global organizations? Many a time, things like permanent establishment, things like how do we really operate as a global organization? Those are things that we still need to be working through to become more effective.
Thank you. Mark? Excuse me.
So thank you, and I'd just like to say it's an honor to be invited along to this panel to discuss GCCs. I work for Oracle. It's not a financial institution, but I'm sure that many of you would have heard of us. We've been going for 47 years. Our turnover last year was 53 billion, so we're quite a big business, maybe the second largest by turnover, certainly in terms of software. 160,000 employees, of which our Asia-Pac division, which includes India, is about 60,000, and in India about 80%, a little more than 80% are in the Indian subcontinent. 430,000 customers, about 300,000 users of the Oracle Cloud Services, and our Oracle Cloud Services don't just include infrastructure, but also applications that, again, many of you may well use: ERP, HCM, logistics, CRM, and the key industry verticals that we work in, finance and banking being a very important one. Beyond that, there's things like healthcare, government, energy, and telco. One of the things that we do now, as well as software, is hardware. We build our own silicon and our own environments, and we can put those environments into your data centers so that you can have a private cloud, or you can have the Oracle Cloud, if you like, in your data center. Now, India is one of our largest companies within the Oracle business. We have a long-term commitment to India. It's, in fact, our second largest group of employees. And we've seen something like 100% year-on-year growth for the last 3 years in terms of usage of Oracle Cloud Services. And as a reflection of the importance of India to Oracle, we're spending about $10 billion over the next 3 years to put 2 more data centers in. And when it comes to the GCCs, our story kind of, I think, is the evolution of GCCs in India. We've been here a long time, as I say, and we very first started using GCC type functions for low-level business process, transactional work, task work. But what we've seen over the last, certainly the last 10 years, is the abilities and the capabilities of the staff we have here really pushing that up beyond the transactional. So now we do research and development here, we do coding here, product management here, and many of our complete management functions have now moved to India. And I think what it shows is how the GCCs have evolved from being like I say, a task-oriented transactional centers into real value add, and of course providing real, genuine employment opportunities and progression for the local teams that we employ. Now, we have more than one GCC, and we expect to have another 1 or 2 in the next few years as well. But there is a change afoot. Technology is changing. We mentioned AI, and particularly AI agents and deep learning are things that are going to impact the way, the shape, and the function in GCCs. And I look forward to discussing that a bit later in the day.
Thank you, Mark. And it's fascinating to hear from 2 people who actually run GCCs here, because there's a lot of talk about GCCs, largely I think from more an external perspective. So it'll be great to hear more as we go along. But let me move to my friend Kaustubh here. I mean, I know JP Morgan has a fairly large GCC here, give or take about 60,000 head count, and then lots of work gets done from here. So Kaustubh, from your perspective, what are the key factors that have made India an attractive destination for global financial banks or institutions like JP Morgan? And if I can just add a bolt-on question, are there any lessons that can be learned that you want to share with this group, or the best practices that you want to share with this group?
Sure, thanks, and good afternoon, everybody. So I'll probably just take a step back to see or explain how our journey has been with our, I think, as was discussed, corporate center or service center or captives. I think we've used all 3 terminologies, but we call it as corporate centers now. We started our corporate center with about 200 people in 2003-2004 in Mumbai. And all we were doing then at that point in time is support some of the investment banking research activities. That it was limited to that. But I think what we now have is effectively 65,000 employees. But more importantly, the nature of the work I think that JP Morgan does with our team is so vast that it covers banking, markets, retail, asset wealth management, and also fund and accounting services. So if you look at any central function that we have in our company, we effectively have the follow the sun model. So I think 24/7 service delivery for all of us. And I think every single function globally that is there is extremely well represented by the corporate centers that we have and employees that we have at senior leadership levels in the corporate centers in India. So that's one. The second one is just, if you look at even a lot more complex functions. So let's say financial planning and analysis, we'll probably have 3,000 accountants who would be looking at all our quarterly disclosures. We'll have several thousand people only doing regulatory filings for JP Morgan all across the globe. We'll have several hundred senior US, UK, and other qualified lawyers who would be looking at all our markets and transaction documentation to review that in the most efficient manner and automate a number of those things as well. Currently, I think there is enormous amount of work that we are doing on quant research and other research functions. In fact, specifically to equities research, which normally I think you must be looking at various analysts giving their commentaries, we now have a number of global companies which are actually covered by team members who are based in India, and who are writing research analysts covering each of those, which means we now have domain knowledge and expertise on each of those currently being delivered jointly with our global colleagues and with the colleagues based in India. So I think the most critical part, therefore, is that the differentiation between what is, I think, a role that is facing the external client and what is facing the internal client That I think is an important criteria or parameter that we use. But apart from that, every material important function and business effectively is represented in India. And obviously, given the strength that India has on technology side, at least in JP Morgan, of the 65,000 odd people that we have, almost 30,000 people are technology people. So they're programmers, coders, and therefore, like I think Mark talked about Oracle, which is a very large technology financial services company, a material part of our IP and product development that is deployed by JP Morgan globally actually is co-worked on by this 30,000 technology team in India. So that I think is our journey in terms of how we have progressed, which is we are now very integral in terms of how JP Morgan works. In terms of lessons, I would say the biggest one to Tanay's observation was actually around COVID time, because our employee strength at that point in time was around 26,000. And COVID actually created extremely difficult challenges for companies in terms of one, business continuity, but more importantly, managing costs and capabilities in the most optimal manner, because different businesses were struggling with different challenges. So I think in JP Morgan, we use that opportunity to really ask very hard questions in terms of what all can we do and what is limiting us in terms of our ambition on scaling up our corporate centers. And that's really where we effectively shifted completely to the other side in terms of how substantive we want to be. So I think a large portion of our growth has actually happened only in the last 4 years on the corporate centers, primarily because we thought how integrated we can be in terms of our delivery for what we are doing. Thanks.
Thank you. Great to hear that while COVID obviously was a national global disaster, it did have some, even if, the benefits obviously cannot be set off against the huge costs that the world paid or our country also paid. But yeah, Mark, coming back to you, you have a presence in multiple states in India, right? So, can you just share with us what does an Oracle think? Should I go to this state, that state? Is it infrastructure? Is it people availability? Is it ease of building the campus? And, and what exactly have done to, do they come to you and sell to you in your head office? Can you just share with this group here what states do and in your mind should also be doing more of?
Yeah, there is a lot of choice now. In the past, it was quite narrow, but you see some very entrepreneurial stuff going on in many states. And what you can get is access to infrastructure, to buildings, regulations, and so on. So the choice is broad, but what we focus on is the availability of skills. And this, I think, is, for me, the key challenge and the key opportunity when it comes to GCCs in India. So we look at the education systems in those particular areas, and we intervene. So what we plan to do in those, when we're actually building these things out, is talk to the faculties that we're interested in. It's usually business and finance, and then IT and computer science, and say, look, we want these skills, but we want them with having the right capabilities to be productive quickly in our environments. So what we can do is work with the universities and with the tutors to embed Oracle-specific training into the final year of that student's life at the university. And they graduate not only with a degree, but also with what we call the Oracle Certified Professional, the OCP certification, which is our sort of test of competency that we put it forward. So what we can then do is bring workers in at a relatively junior level, but already have hands-on experience and proven capability when it comes to Oracle technologies. So, as I say, I believe this is an issue not just for Oracle, but for anybody running GCCs. We see in some states, there's a term that some of you might have heard, lateral hiring is the polite way of putting poaching. So many of the GCC centers will hire from their competitors down the road. Now that's a fairly destructive process, because what it does, of course, is it means you get churn, you get wage inflation, and of course you get disruption. What we need to do is break that cycle by introducing new blood, because you get a higher degree of loyalty and certainly a lower cost. But what's important there is if you do bring people in, how quickly can you make them productive? There's some organizations say there's a third. There's culture, there's process, and then there's technology. Well, if you can find ways of breaking one of those, in our case, the technology, by making sure that the candidates that come in have already got that capability, then you are accelerating it. And we also find a higher degree of loyalty. The other aspect about this, and this is another churn-breaking process, is what we call lifelong learning. I know it's not an Oracle phrase, everybody uses it, but to make sure that, there's a lot of reticence in GCCs to invest in training of staff because they're only going to leave and go to the next opportunity. Whereas if they see that the training is not an occasion, it's not a particular point in time, but it's a long-term process, that there's an investment in the individuals, a high degree of loyalty and a high degree of productivity. So I think the short answer to your question is what we really look for is skills and capabilities to drive our decision making.
I think just as a follow-up to that, right? I think there's a lot of talk, including I read in the press this morning that the government and the states are very keen for GCCs now to look at tier 2 and tier 3 cities, right? I know many GCCs are also struggling with availability of people in the 4-5 cities and the cost of people and the cost for those people in terms of rentals and things like that. So, I mean, is this thinking that let's try and encourage an Allstate, an Oracle, a JP Morgan or an HSBC to really look at tier 2 or tier 3 cities in India, is that first of all a practical thought process, or should we be guiding them to do something different in the tier 1 cities itself? And any other comment you want to offer on this subject?
And I'll put it on record, we are out of Pune and Bangalore. But Pune is nowhere a tier 2 city, so it is a tier 1 city is how I would start with it. But at some point in 2015, when we started with Pune, there was definitely that thought to say, should we be going to Pune or should we instead go to a different location in there? And most of us, as we come into the country, have a lower risk appetite when we look towards the city. The things that attract us is infrastructure, that proximity to an international airport, the access to talent, the ability to build out capability in that form and shape in there. And that makes it more obvious to go towards the tier 1 city. And for us, the first hop was in Bangalore. So we came into Bangalore in 2012, but as our familiarity to the country grew, we went to Pune at that point in time in 2014, 2015 to actually set up a center there. Now, fast forward today, Pune is a very thriving GCC center and most of our peers are in and there. But for ourselves, the primary mover today is talent. So yes, if we were to go and look at the third city, and I know multiple new locations have been explored if I look at the GCC place, Jaipur, Gujarat, and especially with what's coming up there at the IFSC. There is a lot more options that are opening up where talent can be extended to. And again, I will go back to that pandemic example, where at one point in time, we were actively thinking of how we get into a hub and spoke model. What really meant is as the year or two extended, we were finding that our workforce had got dispersed out of the country. And so did it make sense for us to start opening up smaller satellite centers across the country? At the end, we finally still chose to stay with Bangalore and Pune, but that is definitely a thought that, and I'll speak for Allstate, that many of us are exploring. Maybe we are still, if we were growing as rapidly as we were growing in the last 3-4 years, absolutely that would be a place to go.
Okay, Kailash, for you now. In my office there is a Kailash Kulkarni, so I get mixed up a little bit sometimes. I many times call him when I want to call you actually. So, but just from given the very large corporate center that you have here, I mean, do you think India's regulatory environment and the government initiatives are sufficient? They support the growth of GCCs? You can speak about the financial sector, but if you have awareness of non-financial, that will also be beneficial to this audience.
And I think in terms of, like within my background also is more on the client coverage side, and I'm not responsible for the GCC, but reflecting on a very substantial number of, I think, client dialogues that we have. If I would say, one, I think number of at least MNC companies, and just to think this through, right? Primarily the client base that we have is US and European. Very 95%, that is 95% of a client base. Outside of US and Europe, GCC as a concept has been very little explored extensively by other geographies. At least that's JP Morgan's experience, which means if you look at even English-speaking countries, which are, let's say, Australia, a number of Southeast Asian countries, and non-English-speaking countries, such as Japan, Korea, etc., the prevalence and how intensely that they are even looking at India as a capability center is very limited in our experience. I'm sure that will change over time. So one is there is a lot, I think, that we are saying with the clients in terms of trying to understand how they can effectively respond to big changes which are happening for all global corporations, which is availability of employees in their local market, cost point at which they can get it, more importantly, capabilities which are available, age of the workforce, and ultimately, therefore, the overall work experience they can get and quality of work they can get. So I think India, therefore, is becoming increasingly important for a number of clients as they think through their decisions in terms of how they want to get work done on a day-to-day basis. That, I think, is key learning number one. And therefore, in that context, Hiten, to your point on government involvement, government role, and what are the challenges the clients are facing, I think to begin with, when you're small, I don't think there are any major issues because government generally does not come in the way or get in the way of that. Because generally capability centers outsource all the real estate and other infrastructure to other agencies. Once they get a certain minimum size, maybe of 1,000 to 1,200 people, they start thinking about space requirements for themselves. And then when you get to 5,000, 10,000 people or more, and the scale of your, I think, location becomes large, the whole real estate planning becomes important. And that's where what can the state government do, which state government subsidy or benefit is important. All of those factors become relevant only once the GCC has reached a particular size and scale. So that's observation number one. Observation number two, I think that we have seen is increasingly some of the GCCs are becoming very sophisticated in terms of what the work they are doing in their premises, which is internal vis-a-vis something which could have a potential revenue impact. And in fact, there are a number of clients of ours where the senior leadership is responsible for large global roles. And that is where a whole host of issues in terms of transfer pricing, permanent establishment, whether the revenues, therefore, they are generating outside of India could be taxable into India, and whole host of other complex issues are now coming up for GCC clients of ours, which have scaled up. And I think these are not limited to just one or two, they are there in number of other clients. So fundamentally, I think clarity on, from a government perspective, the nature of work, how taxation will be, the APAs, which effectively are government-to-government bilateral agreements which give tax clarity for corporations for the work and taxation rate which is applicable for them, are now becoming quite important and serious issues for the larger GCCs. So I would say, I think, by and large, for the smaller companies, it is really not an issue. But for the larger companies, these are becoming quite important issues as they think through how to scale up even more, because as I said, the business environment is such that the compulsions for companies to use India as a great pool of talent are only increasing rather than reducing.
Can I piggyback on that one? And I think this forum in that sense is quite useful, and I'll give credit to CII to bring this together as we have regulators, government officials working through this. And I'll piggyback a bit in what you said, but I'll add to that list. So yes, APA and permanent establishment are two things I'll comment on, but I'll add to that list. Just in some of the earlier sessions, we have been talking about how do we invest from a human resource development perspective, how do we really make our workforce more employable? And most of us end up replicating infrastructure to help make people more employable. I'll give our example. We are in insurance, and that too more in the property and casualty space, where we've got an academy running for people to understand how construction management works, specifically from a US perspective. In India, there is a lot that happens with brick and mortar. In the US, there are things like drywall, carpeting, shingles, gutters, which make no sense for us, even the ones coming out of the construction management space. And I see there is an opportunity for us to tie up and work together in terms of even influencing the curriculum of the ones who are coming out to ensure we pretty much get people up and ready rather than finish a degree, come out. Many a times we don't even need a degree. What we need is some of that vocational skill to be coming out for not every role. But even in the area of technology, there is a similar thing that I would add there. I would also add a lot of us create e-waste. And today, each one of us handles that e-waste in a fashion that is very specific to us. There are guidelines that we work with. But to be able to do that at scale, and every year as we go forward, that both from an environment perspective, but also the way we do it. I'll say e-waste and ESG. All of us are investing in that space in there as well. But getting a better collaboration going will definitely help. And then APA and permanent establishment. I think on APA, my only comment is, even when we go for a renewal, it feels like it's a brand new APA that you're doing. So you know us, we know you know our business, yet it goes through a very long process. So I think bringing efficiency there and working together would help.
Good, thank you. We'll give ourselves about 5-7 minutes more and then take any questions if there are. But Mark, if I can come to you, we are currently, all of us in India are a little guilty of just, India is great, India is the best, there's nothing else in the world has to come here, etc. But, you are a global company, obviously have worked in many parts of the world. So how do you see India's GCC ecosystem, people, technology, state support, center support, fiscal policy, etc., and benchmark that to, let's say, other markets, which also are doing so? We just don't talk about it as much here.
I think it's interesting that a number of other countries in this side of the world look at the GCC phenomenon in India and want to replicate it. So specifically countries such as Vietnam, Laos, Cambodia, they look at this and try to understand what the secret sauce is. Now clearly there's government support is one and infrastructure is another, but again it's back to education. It's this country has a phenomenal capability when it comes to producing educated young people. And that's what they're scrambling to catch up with, is to be able to educate in the right way at the right scale. And some of them are doing reasonably well, but this is going to be a long-term process. But what they don't have is the size, the scale, and the momentum that exists here. So I think it's going to be tough. But certainly I think that's where we see the most movement. South America is another one where they're beginning to look, particularly around systems development within a sort of outsourced, I wouldn't call it quite GCC yet, functions, where we see it. But I think those are the two areas which are looking at what India is doing and saying, yes, we want some of that. But as I say, at the core of it is always about the skills. And if there aren't the skills there, there's no point in having a shiny big building with lots of screens if the skills aren't coming in.
Fair point. Maybe just starting with you, Kaustubh, just wrap up comments, what's worked really well, what's needed to be done as a scale of urgency. How do we make sure that the next round of big GCCs, whether from the financial services in US or from anywhere else in the world, is it a promotional activity, is it a tax incentives, is it ease of acquiring property, is it keeping real estate prices at reasonable levels and aligned to market reality as opposed to just something else? So how do we make sure this goes and grows for the next decade or 2 decades and becomes a very integral part of the broader India story?
Yeah, I think I would not be too worried about real estate infrastructure because those, I think, issues are quite well sorted in most of the cities. In general, I think the ecosystem in India, in each city is smart enough to, I think, find solutions for those. But the real one, I think what we need to understand is that we now have reached a very, very critical scale for the capability centers and on an aggregate in the country, which means there is a very substantial pool of talent which is now currently prevalent in the country. And what we should appreciate is that that also is a critical talent for all of or a number of the new products, businesses and new corporations that are going to be created in India. So we are also seeing, and we have, at least in JP Morgan, we have a number of these innovation forums where we invite companies which are developer companies, smaller size, mid-size companies, and the amount of, therefore, learning that we are seeing from large corporations and the startup ecosystem in the country is phenomenal for country as a whole. And I think in terms of policy level initiatives, the larger scaled up capability centers and enterprises have to do a lot more in terms of their engagement with the commercial enterprise in the country, the technology enterprises in the country which are small and upcoming, because that's where we are going to create very material talent, capabilities, and brand new businesses in India. And that, I think, is clearly has been the effort at GP Morgan, but I think number of our peers, I think, are doing or should do a lot more of it. And the second, and so that's one, because that's real contribution to the ecosystem. The second one, I think we talked about is skilling and building the capabilities for entry-level talent, which is a problem across the country. In GP Morgan, we hire at any point in time 15,000 to 18,000 new people just to deal with growth as well as attrition, which means we have to visit like 1,000 campuses. It's a machine that we have to handle. So I think net skilling at the entry level is across the spectrum requirement for all GCCs. Right now, they're each of them trying to do it individually, but clearly an ecosystem which could effectively, on the likes of ITIs, which was primarily designed for manufacturing kind of jobs, we need to think through what kind of state or central level initiatives can be done to create right kind of skill set so that the workforce can move to employment and start being productive a lot more efficiently rather than companies spending a year or two in effectively training them as they get out of college. And the third one I will come back is effectively a more better clarity on the tax framework, particularly for cost plus model as well as cost plus revenue sharing model. And the sooner I think we can get to a good framework on it, I think it will therefore also result in more of the higher end revenue sharing type of work coming to the larger GCCs than what it is currently happening. So 3 points from my side.
Thank you. Tanay, any points from your side?
The way I'll respond is, in terms of new GCCs coming into the country, and many of us, and I'll speak for myself, we end up hosting either through a NASCOM or through a consultant where new GCCs do their tour through the country. They would want to come and see, does this concept work? How do I start? What is the learning? And my input is, it's no more a learning. It's no more, should I try out a certain thing? This is a proven model. Enough and more of that is available. Enough of more partners are available who can pretty much put it in a GCC in a box and switch start it in a really, really compressed time. You don't have to go through the pains that the others have gone over a period of time. And then also to that question to say, well, where else should I go? And with a tinge of arrogance, I would say, for the scale in which India is doing, whether it's a Vietnam and I've lived in Philippines for 3 years, whether it's a Philippines or South America, or Eastern Europe or elsewhere, nobody's got that scale, that quality, reliability, talent at the cost point that India can be speaking. In certain sections, absolutely. What Israel is doing and East Europe is doing in terms of cyber security, or what Philippines is doing in terms of being the voice capital of the world. Those are specializations, but not across the board. And so from an India perspective, that's a benefit. What I would definitely put in is, why do we need so many people within the GCCs? And especially in a world where we are talking about technology, do you need as many people to be in there? And with more and more of that technology change coming, as a GCC, how do you future-proof yourself? With GenAI coming in, am I going to embrace it or find it as a competition in there? And that's both for the work in processing or technology or analytics. Even in technology, Copilot, GitHub, that question, do I actually need a coder in the future, is a reality. And so I would say we'll need to future-proof ourselves and embrace that technology to ensure we have the human in the loop and figure out what we want to be doing for the future.
Last.
I think it's a really strong point that you've just made around the technology changes that are coming, and they're going to come. And AI is the one that everybody talks about. And generative AI and LLMs are the thing that most people know of when we talk about AI. But the intelligent agent aspect of it is one that will have a real impact, particularly on the sort of lower level, more transactional tasks that many people do in a GCC today. These systems effectively imitate a human being doing the transaction. It's a bit like a robot assembling a car. once the robot's been taught how to put the piece on the car, it can do it repetitively. And AI agents will do the same thing. And so what it means is many of the lowest level task work that happens in GCCs are likely to become automated. And what that means is it presents an opportunity for the workers that are there at the moment to elevate and do more meaningful work and hopefully earn more money in doing it. But things like coding, again, you hear a lot about that the coding is going to disappear. Developers will no longer have a job because the AI will write it. Today, if a coder is typing code into a screen, then yes, those jobs are likely to diminish significantly. But the job of a coder becomes one of understanding the transactions, knowing the edge cases in every aspect of it, and building as what it's called in AI terms, the prompts that then the AI can go away and build the code. So the jobs will change, they'll become more elevated and present more opportunity. And this change is happening now. It's not something that's 5 years away. This is embedded in Oracle products and many of the other technologies that you'll use, and this will become a reality very quickly.
Good, thank you all. If you've got questions, I see one hand there. If you can just raise your hand so I can just reach out to you thereafter. I'll come to you next, sir. Yes, sir.
So my question is...
Can you just tell us about yourself and whom you want to answer this question?
Yeah, my name is Amit Lamba. I want to ask from Kaustav. So, like you said, you are taking care of USD and all. So just wanted to ask, like, there is a predominance of that currency. Like, if someone is supplying to X country, or so that when the remittance comes in, so it usually converts into USD, then into that country, or that of that currency. So don't you think for a country like India, is it good? And if not, then what is the solution for this?
Can I use my... I think it's a very relevant question. It's just not linked to the discussions we are having here. And currently, I think just yesterday, I think the outgoing RBI governor said at least India is not trying to de-dollarize. So I think, but excuse me, but I think this is not, what we discussed here. So yes, sir, here.
Yes, my name is Manish Sharma. My basic question is that how can we make GCCs much more competitive as far as these innovations are concerned? Because we are finding that as far as GCCs are concerned, they will require a lot of these data, seamless integration of data, seamless integration of patents also. There will be, with their vertical integration will also be required with their headquarters, Because previously we had BPOs, which basically used to do a lot more of low, documentation at the low value chain, But with GCCs, they will require a lot of innovations, So there should be seamless communication between the top end and between the headquarters and with their local units. So how will that be possible? Because in future we are going to be having regulations with data also, because there are a lot of protectionism, as far as US is concerned with the Trump administration coming in. They will definitely want their data to be much more secured, So how do you see that future, going forward, see as far as GCC is concerned, or is it, will it work in silos only?
Can I request both of you to give brief, short answers?
Yes, you mentioned about communication and data security. So you're quite right. Many organizations will have regulations or sovereignty requirements, or indeed just decide that they want their data in a particular place and not in somebody's cloud somewhere else. Our response to that at Oracle is that, well, we can put our cloud into your data center, which means that you've got a complete security around it. You get the same economics as you would do if you were using a public cloud, but you do have the knowledge and the security that your data is staying within the country or within the particular area.
And I'll probably agree to that and add in there as well. From a GCC perspective, it's just one organization. You might be across multiple countries, multiple states, but how you operate, how you really put in your tools, how do you put in your processes, from an innovation perspective, how do you drive those ideas to conclusion, will have to be in an integrated. I don't think we can draw boundaries by countries. Now, I understand from an IP perspective, and I understand from a data perspective, some of those boundaries do get drawn. But as an organization, it will have to be very integrated. Customer data lies in the country where the customer is from. And I think that will be the driving factor rather than the country as such?
So we have literally time for only one last question. Yes, sir.
I'm Arvinder Brara, Chairman and Managing Director of Mantech Consultants. My question is, with this GCC revolution, how do you feel it'll impact the normal outsourcing of US and other companies to organizations in India? Because that's a kind of smaller organizations cannot afford to set up their own GCC centers. So what do you think will be the interplay between these two?
Want to have a shot at it?
We are seeing that very, very active and well functioning. Because do remember, India has also one of the most sophisticated mid-size, small-size and large-size IT services companies. And number of IT services companies have humongous sales and distribution and engagement with clients and customers in all parts of the world. And that's where I think their capabilities and the rate at which they are offering solutions to, let's say, mid-sized corporations elsewhere internationally who do not have the ability to set up full-scale capability centers in India. This is where the Indian technology and services companies come into picture. So we almost have dual-headed companies where people have teams capabilities in US, teams capabilities in India, and that's how I think that client is being serviced. And these are the clients again for companies like HSBC and JP Morgan. But that's a very, very active and functioning market.
I think, sir, if I may just, I will, there is insourcing happening, and that means outsourcing will not happen from large companies. Whether our large IT outsourcing companies are geared to serve small customers, I think, we will discover, but I'm going to have to call this session to a close. Thank all my panelists for the wonderful discussions and the sharing of their experiences and their journeys and their knowledge. I think it clearly looks like that India is, what we are struggling to achieve on a China Plus One in manufacturing, we have without government thinking or planning achieved this here, so which is a wonderful thing. As you mentioned, we have scale, we are now doing high-end cutting-edge work, artificial intelligence and things like that will make it even, that'll have challenges and opportunities both. I think the one word I heard a lot about was skills. If we want to maintain and sustain the advantage that we have, we must make sure that our graduates are trained to work in activities that, that the GCCs do. And of course, this is a competitive world. We should not become complacent. There are other countries which are picking up the benefits of having GCCs in place and the benefits it does to employment, to ecosystems, to industry, etc. So on that note, thank you all. Thank you, my fellow panelists. And we'll call this session to a close. Thank you.
Thank you so much. May I request Mr. Hitendra Dave to kindly present a token of appreciation to the speakers, please. And may I request Ms. Tanushri Banerjee, Deputy Director General CII, to present the appreciation token to Mr. Dave. Would request the speakers to also step forward for a photo op. Thank you, ladies and gentlemen. With this, we close this session. However, please remain seated as we will shortly begin the next session, Humanity Without Humans, how to thrive as population sinks. Ladies and gentlemen, we'll shortly begin the session, Humanity Without Humans, How to Thrive as Population Shrinks. Request you to please remain seated. You may take your tea, carry your tea, and please be seated. Ladies and gentlemen, please join me in welcoming the speakers for the next session. Mr. Sanjay Kapoor, Dr. Ruchir Agarwal, Mr. Lohit Bhatia, Mr. Rajiv Gandhi, Mr. Nirmal Singh, and Mr. Atul Kumar Tiwari.
I'll see it. Okay, good evening, good evening, everyone. Let me start. It is my privilege to welcome you to this thought-provoking session on humanity without humans, how to thrive as populations shrink. As unconventional as this topic may seem, it touches one of the most profound transformations facing humanity in the 21st century, which is the reality of declining populations. And today we have a very distinguished panel to share their perspectives on this subject. And before I introduce them and invite them to share their views, I'd like to begin by setting the context for this discussion. For decades, global discussions have centered on the challenges posed by overpopulation. Yet today, many parts of the world are grappling with declining birth rates, aging populations, and prospect of population shrinkage. Countries like Japan, Italy, and South Korea are already experiencing this shift, and many others are projected to follow. Just to give you some data that I recently read or came across, in Japan there are 47 prefectures, and of the 47 today, and what they consider old is, or an aged population is 85. None of them have a majority of aged people. However, by 2030, 20 prefectures will have the aged population, and by 2030, 46 will. So we're really in a state where the number of old people is growing. The global birth rate, defined as the number of new births in a year per 1,000 people, is around 17 in 2024, down from 24 30 years ago, and 31 50 years ago. So on the other hand, life expectancy has increased from 58 years in 1974 to over 70 today. The world as a whole has now more people over the age of 64 than children under 5 years of age. And this has happened for the first time in our history. The demographic transition raises a question as to how economies will adapt to shrinking workforces, rising dependency ratios, and increasing pressure on healthcare and the welfare systems. Economic growth, as we traditionally understand it, relies on a growing population to drive consumption and labor force participation. Population declines challenge this model, creating the need for alternative frameworks. Technology advancements offer an opportunity to do more with less. Robotics, AI can compensate for labor shortages while driving productivity. But then you need people to drive the evolution of technology and innovation itself. I'm going to ask them to show you a short video of robotics at its best. I was recently at the We Robot launch in California, and because I'm from the automotive industry, I must proudly showcase what the automotive industry has done. Can we show the video, please?
Here you go. Thank you. First, what's your name? Samir. All right, welcome. Nice to meet you. Thank you. That's one? Can you please tell me a joke?
Starting rides, and there's you kind of.
All right, that's fine. Enjoy it.
So that's really what we see in the future. So it is also important to note that demographic changes differ widely across countries. So immigration offers a pathway to mitigate population shrinkage while enriching societies with cultural diversity and global connections. However, immigration is a very controversial issue today. India, with its significant demographic advantage, is uniquely positioned to address the challenges of shrinking populations globally. Indian youth can drive innovation and technology for the world while also addressing labor shortages and productivity challenges in aging economies. With this context, I would like to invite our distinguished experts to share their views. I will begin with Dr. Ruchir Agarwal. He's a co-founder and president of Global Talent Fund and director of the Raj Center at Columbia University. He's also a research fellow at the Harvard Kennedy School and spent over a decade at the IMF addressing financial crisis and global economic challenges, and has been an advisor to the IMF, UNDP, WHO, and the G20. Richard, you want to come here?
Thanks. Good afternoon, everybody. I hope everyone's awake after lunch and are ready. Could we please have my slides up on the screen? And while they put this up, I have about 20 minutes before the other distinguished speakers follow. And what I'll be talking to you about once you start seeing the screen in a few minutes is the title of the session, which is Humanity Without Humans. Is there a chance that we get some slides on this screen? Yeah? Okay, while they pull that up, let me start by telling you a story. About 160,000 years ago, there was a woman who in the scientific literature, we call her the mitochondrial Eve. Have you ever heard of the mitochondrial Eve here? Yeah? So you have, right? So she is the mother of basically everyone who's living today. So all living beings today, all human beings can trace our lineage back to her. And so in many ways, the story of humans, I would say we could, if anywhere, we could start with her. And let me just see if there's somebody putting slides. They are, okay, yes. Just putting some pressure on them to get going. But the story of, I wanted to start by defining humans and humanity. And so I would say let's start our story with her. And then for this 160,000 years, the history of humans have been very closely tied with population growth. And population growth has gone hand in hand with economic growth, okay? Now, along the way, we've had three major human innovations, okay? And I call them the system of imagination. One is thoughts, is our ability to form ideas and combine them into one. So confederation of Indian industries, three different ideas put together, you get CII, so the formation of thoughts. And from there, we, about 70,000 years ago, came up with language, the ability to convey those thoughts to people around us, like I'm doing right now. You all can hear me. But then about 5,000 years ago, we invented writing, and that allowed us to communicate with people across time and space. So today, we can open the Upanishad and connect with somebody who lived over 2,000 years ago, which was not possible without the technology of writing. So in many ways, how I think about humanity, this is what I'm going to be talking about. We are in the from humans to humanity part. Sorry, let me just show you since I'm here. This is basically the map of how the mitochondrial Eve, who lived about 160,000 years ago, there's a black line. All the other siblings of hers basically died out, and everyone else today are basically descendants of this black line, okay? And so what I'm going to be talking to you about today is this reversal that we are facing, which is fewer people must drive greater output, okay? Now, as I was telling you, these three major human innovations, thought, language, and writing, and they collectively gave us what I call collective imagination. And this is my definition of humanity for the next remainder of my talk. And if you think about it this way, what these three things allowed us to do was accelerate economic growth along with population growth. And now the key question for us is, if population growth goes away, can humanity's collective imagination still advance and progress? So the way, one analogy that I want to share with you is, before the Olympic Games, there is the Olympic flame that is lit in Olympia, and this begins the torch relay. And so these runners then carry this torch all the way to the host city where the Olympics is being held, but only the flame changes hands, not the torch itself. So the way I think about it is, each individual humans, all of us, we are just the torches, and humanity is the flame that is passed all the way since mitochondrial Eve. And so the flame is our collective imagination, which we use thoughts, language, and writing to pass down. And the key question for us today for the panel is, will this flame burn brighter with fewer torches? Can we sustain growth and innovation as populations shrink? Okay? So I just want to use that to define things. And if you take my own, my maternal grandmama, my Nani, she was one of 8 siblings. My mom was one of 7 siblings, and my generation, my sister, it's only my sister and me. And this story, I'm sure, is true for most of you. If you look at your grandparents, your nana, nani, or dada, dadi, and this is kind of what's happening. And the graph here just shows you the average number of family members, kin, a 65-year-old woman has in a given year, and India is the green line. And basically, the reality for us is family sizes are shrinking. Okay. Now, on the economics of population decline, the second topic. Today, this year is very interesting because 2024 is the year China's population is peaking. So every year from now on, China's population will shrink. 2 out of 3 people in the world today live in a country where the fertility rate is below replacement rate. That means, on average, women are having less than 2 or 2.1 children, such that there's not enough children in the next generation to replace this generation. So they're shrinking. And India, many people talk about India's demographic dividend, but I'm going to argue here is India is already very much facing this reality. So it's not just about the story of Japan. I'm going to talk to you about how this reality is coming to us much faster than we think. And India's fertility rate is today below replacement rate. So the next generation will be smaller than this generation. Okay? And there are predictions and there's a black line, that by 2050, this could be as low as 1.2. So every woman, on average, will have 1.2 children. And that's a big, and this just shows you fertility rates by different groups, but I'm going to go. So what are the consequences? The declining fertility goes beyond demographics. It just reshapes economies. The lower birth rate leads to shrinking workplaces, slow GDP growth, and it creates irreversible pressures, okay? And one of them is through innovation that I'm going to show you in a second. But before I do that, just want to show you some basic fertility arithmetic, okay? So if you have a fertility rate of, say, 1.5 or 1.6, which is roughly what Maharashtra or West Bengal have, that would be corresponding to the yellow line here. In 2 generations, your population will halve. So if you have a cohort of 100, in 2 generations, that'll be 50. That's the reality we're talking about. And there are states in India that have already reached that level, okay? So it's not a very distant future. Now, one question, of course, is why are families shrinking? In a way, what evolutionary biologists think about this question, they say, there's a fish model on one side, which is you produce many offspring and you don't care for each of them and you hope that there's strength in numbers. And then the other extreme are the elephants, which is you produce very few, 1 calf every few years, and you take a lot of good care of them. And humans are just extreme elephants. We have fewer children and we just put a lot of energy and investment. In fact, humans are the only species that have adolescence, that we have this period where you have the capacity to reproduce, but you don't really fully grow. You don't reproduce. But one way to think about this question is just a higher cost of raising children. If in that reality of extreme elephants, the cost of raising each child goes up, you're going to get, at the same time, three things happening. First, parents will prioritize quality over quantity, and so you have more investment per child. The second is raising kids is more costly in time and money, so you're going to have smaller families. And the third is you just need more money to raise kids, so more women will choose to work than they would otherwise. So, and these are the three realities happening all around the world, including in India at the same time. Now, what are the implications for India? Just a moment, yeah. So, first implication is, and this, when I plotted these numbers, I was a bit surprised myself. People, when they talk about India, they look at the black line, which is the population, and they say, look, in the baseline, India's population will peak by 2060, so we still have a long way to go. But if you look at what I have here is the red line. In India, they consider the working age population to be 15 to 59. That's the red line. That is going to peak probably by early 2040s, so little over 15 years. So in 15 years or so, there's another way to look at the same chart, which is in decline, in change terms. Today, India adds about 10 million people every year to the workforce. 10 years ago, that was about 15 million. But in 15 years, it'll be zero and negative. So the workforce is going to start shrinking, and that's what the red line shows you here. And this is a big, I would say, it will have major implications for everything, including things like youth unemployment will no longer be as much of an issue that it is today. The second implication is we will have a two-speed, we already have a two-speed India, but this will become really big, deeper. And what I have for you here is on the map you can see is the fertility rates for the most recent year available across all states. And you can see Bihar, for example, is on average each woman is having 3 children. But you have states like Bengal, as I said earlier, where the number is 1.6, Sikkim is 1.1. And so what will happen is we will have very different population, there'll be massive shifts within the country in terms of economic power and in terms of population power. And a third one, which I also found quite surprising when I ran just the numbers, is if you look at GDP growth, now there's a big question happening. I'm a macroeconomist. I work a lot on macro growth issues in India. The big question is, why is there a slowdown in the economy? Already since 2000, about 1.5% of GDP growth, percentage point, has been reduced simply because of demographics, because of lower population growth and because of the shrinking working age population. And by 2040, there will be 2 percentage points, and by 2050, 2.5. So when people are talking about can India grow at 7-8%, every year this will just get harder and harder. And this is a big impact. It has implications for FMCG companies, for example. It has implications for many different, for all the companies which my fellow panelists will talk about. It'll have implications for their net worth going forward as well. So, and then the fourth implication, if you look at, since I'm at industry conference, if you look at industry reports, they often focus on India's demographic dividend. But if you actually do these numbers for India's definition of dependency ratio, which is how many people are there who are not working compared to who's working in terms of working age population, we have only 2 or 3 more years for the demographic dividend. After that, that dependency ratio is just going to rise. So I would say a strong statement would be demographic dividend is going to end, or is practically ending now. And so we need to change the narrative and stories that we carry about India here. Now, implications for the world, I want to just focus on 2. First is, I would say many of the problems we think are problems are already yesterday's problems. Climate change for one. This year may also be the year where we have peak in carbon emissions. It may be the worst year in terms of how much carbon emissions we've emitted ever. And they'll never be as bad as now. And so I think already youth unemployment or pandemic risks or affordable housing, a lot of these problems just become the opposite with population decline. And we've just not experienced it enough we live in a world where we think these are perennial problems. But demographic, I want to show you here, is an issue which just changes the signs of many of the problems. And the second one, and I think this is one of the biggest one, I would say, from an economic perspective, is slowdown in idea production. So here I have an example from Wikipedia. How many of you have used Hindi Wikipedia? Here. Okay, some of you here. At the end, we have about 600 million Hindi speakers in the world. And one way to see the impact of a smaller population is just to see the size of Hindi Wikipedia or the quality of Hindi Wikipedia compared to English Wikipedia. So imagine a world where there are half as many people as we have today. Many of the ideas that we have, bad and good, there'll be fewer of them. And that will have a big impact on space of innovation and growth and not just in India, but the world. And then, in a way, I'm not going to go through the equation, but I just want to show you one point. What will the three forces that will create is, first, there'll be much more push towards automation, as the video showed earlier. Second, there's going to be much more focus on identifying existing talent and maximizing their potential. And third, there's going to be a lot more focus on increasing idea production using AI or generative AI. And here there'll be two competing views. Can AI really spread the scale? Is it just about taking existing ideas and repackaging them? Or is it about generating entirely new ideas? If it's B, then it's not so bad for the world. But if it's A, it may be quite problematic in terms of how much growth there will be in the future. Now, last section on policies. I would say I'm going to share 4 ideas, and I've tailored them a bit towards India. The first and the most important one, in my view, is identify and nurture invisible talent. And India has a huge pool of talent that is just not utilized today. And one way to see this, so I built this journey of 18-year-olds. So for the last 15 years, there have been about 25 million 18-year-olds every year in India. But if you just go through the journey, at the end, only about 2 million of them get STEM degrees, okay? And if you don't even utilize your existing talent well enough, you are basically, India's operating almost as a country. It's not as a 1.4 billion people, but like 400 million. So by just changing the utilization of the talent, of the gift we already have, we can drastically change the rate of innovation for India and the world. And another way to see this, so there's a paper I'm working on, which is called India's Missing Billion, where you can just look at 1% of surnames. They account for 60% of patents, roughly half of publications, and also many people who are actors or cricket players, and so, or company directors. And so by just changing the access of the talent pipeline, we can completely change and this is a gift India can provide to the world, where the world's population is shrinking, not just India's population. Idea 2, very quickly, is on extending the productive life. The more politically sensitive way to say this is extend the retirement age. And as people are living longer, we need to have a serious and honest conversation, and I see many industry representatives here, as what is the right retirement age? And that itself allows same people to do more, and that will be quite important very soon, I would say. The third is, in many ways, one of the other problems I've done some work on is female labor force participation, and there's just not enough. So we have two opposing views. One is get more women to work, but at the same time that leads to lower fertility. So there's a trade-off. So we can do a lot more. I've listed some things. I don't have time to go over them. Happy to discuss later. The policies does that. Those two things are not a trade-off. And the last thing on the policy side I just want to emphasize is, in many sense, a lot of the Indian economic policy is about providing support to the rural economy. Yeah? But that improves the quality of life in the rural areas, but also dissuades migration from rural to urban areas. So in the short run, it may be good, but the highest return for people is to move them to opportunities. And so similarly with fertility, we want to make sure you target the fertility in the places where the children will have the highest chance of becoming productive and contributing to the global knowledge frontier. And so those are the 4 ideas I wanted to share. And just to conclude, I just want to say that in a way, the idea, this is the last slide I've shared with you, is how can we sustain progress with fewer people? Right? And humanity's progress has been fueled by our creativity, our knowledge, and how we've contributed to that collective imagination. That's what I've called humanity. And this, in many ways, will, going forward, depend on how we cope with population decline. In a way, that's an accelerant of humanity's flame that's losing, but can the others substitute that? And in many ways, the thing I want you to take away is India has a big role to play, not just for itself, but for others, by tapping its, or realizing the potential of its untapped talent. And here we have a chance to ensure that humanity's flame continues to burn brightly. So thank you for your attention, and thanks. Thanks for
Thank you, Richard. Can I now please invite Mr. Bhatia? Mr. Bhatia is the president of Workforce Management Quest Corp. He also serves on the executive board of the Indian Staffing Federation, a leading staffing industry federation in India, representing over 100 staffing companies. And Mr. Bhatia has over 25 years of experience across industries, such as textile, auto component, and services. Thank you.
Thank you. And good afternoon, everyone. This is a beautiful winter afternoon in Delhi. You often don't get such a nice, bright sun out with AQI of only 100 odd when you are in Delhi winters. Thanks, Dr. Ruchir. I think the segue into what I want to present today is in very similar lines and similar tone to what Dr. Ruchir just presented. First and foremost, let me tell you, I'll draw a couple of parallels of the last 30-35 years and then build on what we're talking about here today. 1991 is when liberalization started. I'll take you back to 1991. Our population was about 870 million. Today we are close to about 1.4, 1.44 billion, whichever statistic you want to look at it. At that stage, India's GDP was only $321 billion. It's gone up 12 times. So while the population went up 600 million, the GDP has gone up 12 times. Mind you, the GDP has added exactly as much as it was in 2014 to the entire number in the last 10 years. The GDP was roughly about 1.8 trillion in 10 years ago, and today it's at about 3.8 trillion. So just keep that in mind. And with that, keep in mind what Ruchir said, about 15 million people were coming into the labor market every year. That's the 600 odd million which have come in the last 35 years. But something else happened. In this 35 years, predominantly the workforce in the IT, in the white collar jobs, in the postgraduate and above were the beneficiaries of liberalization and beneficiaries of all of this growth. Today we have an IT workforce market in India of about 6.7 million, whichever statistic you look at. The nearest one would be from NASSCOM. Indian Staffing Federation also came out with a report recently. They contribute about $450 billion. And they've gone up by 455 times from when liberalization started 35 odd years ago to today. And that's just a handful of 6.7 million people contributing about $450 billion. At the same time, manufacturing, which contains a huge amount of MSMEs, have gone up only 8.9 times. So 455 times in IT versus manufacturing 8.9 times. Today, manufacturing workforce is give or take about 63 million, contributing close to an output which is commensurate, but now comes the important aspect. IT industry in 35 years has seen a CAGR of 21%. That's a compounded annual growth rate of 21%. their output per person has grown by 14%. Manufacturing during this period has seen a CAGR growth of population of only 7% and an income earning population of only 2%. Why am I raising these points today? Because like Ruchir said, we may very soon be at the cusp of the point where the population starts to decline, which may not probably be visible for 20 more years. So don't worry, any child who's born today will come into the labor market after 18 or 20 years. My own company in 2014 had only 100,000 people working for us. That was the first 8 years, 100,000 people. Last 8 years of our company, we've gone from 100,000 to 600,000. So we are a direct beneficiary of the pool of the labor market. But if the same work in the 35 years was done for manufacturing, we would have seen a huge, stupendous amount of growth. What does that growth translate into economic well-being? If you were to add 100,000 rupees to each of the IT workers today, you add $7 billion of economy. But if you were to add 100 million manufacturing workers, which we actually lost in the last 35 years, the catch-up is happening only in the last 5 or 10 years, whichever way you look at it, that population at an income level of at least 300,000 every year would have added to the GDP a whopping figure of $361 billion. So why does India need an obsession on employment and on formalization? Is because at the end of the day, you can't have a roti kapda makan if you don't have a livelihood or if you don't have a job. So the basis of that is that. I'd add a couple of points, which is where we've seen our various ministries and the government focus in the last couple of years. The labor code, and a lot have been said about it. I just want to leave thoughts with you. I'm not going to dwell into them. The PLI scheme of the last couple of years, the ELI scheme, which is the employment linked incentive scheme the government announced just in the last budget, 2 trillion Indian rupees to be spent for that. The apprenticeship program, the internship program, the ITI upgrade program, enhancing the female workforce participation rate in India, the formalization, that is the informal to the formal labor market gap, and above all, the GCCs. And why do I bring GCCs here? Is for the simple reason, ladies and gentlemen, there was something called a WTO for products, because the countries which need cheaper goods, quality goods, will open their markets for receiving products. They may not be as kind to receive people. They may not give you as many visas to send your people as much as we would want to send those people. So what we could do, or what we have done as India, is that we've opened our borders and our doors to something called GCCs, and now 1.7 million Indians work in almost 1900 GCCs. So that's what is the advantage. And last but not the least, while everything has been said about the Indian labor market and skilled workforce, and I'm sure we've got the Secretary of Skill, he will have the last word on this for sure. Everybody will tell you that a lot of Indians go overseas to work. There are about 13.5 million Indians who work as of now in different countries. The question is, can we make more of that, or do we need to open our borders more to the GCCs for future? I'll end with this and come back in the queue. Thank you.
Thank you so much. Thank you. Can I now please invite Mr. Rajiv Gandhi? Mr. Rajiv Gandhi is a member of the Executive Board of Maruti Suzuki India and is the CEO of the International Automobile Center of Excellence. Sir.
Thank you, Sanjay. Well, I think all of us belong to India, most of us at least. I think being in India is very difficult to absorb this term called shrinking population. It took me some time too, because we live in a country where resources are constrained, we have huge unemployment, you have traffic jams on the road. But I think, as a doctor also spoke some time back, it's a harsh reality today, and something which is just round the corner for our country as well. So we have a collaboration with Japan. It's a joint venture with Japan, and we therefore know a lot of what is happening there. Japan has a very severe problem of declining population. I mean, last year alone, I think almost 500,000 population declined there. Why to talk about Japan? You all heard of China. For centuries, they have been the highest populated country for centuries. Last year, their population declined by 850,000. So I think the sooner we come to terms with this, the better it would be to prepare ourselves for the future. So I think, as was pointed out by Dr. Rucher, it's only by 2040, which is just round the corner, that the fertility rates would fall below the threshold level of 2.1 even in India. So I think that's something that we need to be worried about. So let's, I did some study as to what some of the countries facing huge declines are doing about it. So I think like Japan is giving huge subsidies for families to raise children, almost 1 million yen per child annually. France is a country which has got the best fertility rate in the whole of Europe at 1.7, but still below the threshold level. They have also come up with a lot of generous family benefit schemes. Sweden has extensive parental leave programs. So these countries which are already facing population decline, some of the measures that they have been taking. So I think we have to really look inside and see what we do about it. I think to summarize all this, I think we need to have policies in place to support the working population, especially women, by way of flexible working, remote working, so they're able to well manage and balance between the work and family needs. So what do we do about this declining population? I think one of the most untapped potential lies in is utilization of the female workforce in the industries. Just to give you an example, today, the female labor force participation in India is only 25%, as against the global average of 57%. Even 57% gives a huge potential for increasing the workforce. I think another good example of Japan, to counter the declining population, the former PM launched the movement called Womenomics in 2013 to encourage the female workforce. The women labor workforce participation in Japan increased from 55% in the 90s to almost 70% now. So there you can see the results. Sweden is another unique example which has a ratio of 80% of the women who are working and is attributed to very strong family-friendly policies. I think in India I can only name one good example in this, which is the Ola Electric Future Factory, where the whole of the shop floor is managed by women, and women who are recruited from nearby villages, and they are trained to work in the shop floors. One of my ex-colleagues happens to be in Ola today, and we keep discussing on what they do about it. Maruti has made a small beginning. I would say still a long way to go, but we have recently hired women a few years back, and they are managing one full assembly line on their own. So this is something which is possible and can be done. People talk a lot about one of the countermeasures is increasing the retirement age. I think Japan has increased it to 70, but limited success so far. Germany has raised it to 67. A similar initiative taken by France was faced by widespread protests, because people say we are entitled to retire one day and enjoy life. Why keep working all the time? So you have to balance between the two. But I think even if we increase the retirement age, is very important that these older generation people have to be reskilled to the modern technologies required in the industry today. Otherwise, they would not be relevant anymore. I think we talked about AI, automation, Industry 4.0. All these things are very direct, directly impact the number of workforce required for doing the same job. India is catching on this. A lot of robotics and AI and automation is happening in a very big way. Robots are now, as you saw in the video, in Japan, they have robots called robiers who help patients, old age patients. So, that's how they try to overcome these issues regarding the shrinking population. But again, I think all these technologies, I would just like to mention and end after this. We have this joint venture institute, Center for Excellence in Ahmedabad. Honorable Secretary, I had the pleasure of hosting him a few months back there, where it's a joint venture between Maruti Suzuki and the government of Gujarat, almost 100 crore investment we made. So this basically started by skilling the young workforce into manufacturing processes, automotive technologies, make them job ready. But then over time we realized that some of these modern technologies like Industry 4.0, robotics, as well as the electric vehicle technologies. So we have added all these modules to make it relevant to the industry today. So I would request if anyone happen to be in Ahmedabad, you can have a look, because I think each one of these things require a lot of skilling to be done for the future. So with that, I would like to end, and we'll take in the questions at the end. Thank you so much.
Thank you, Mr. Gandhi. Now let me invite Mr. Nirmal Singh, please. He's a co-founder and CEO of WeBox, an ETS company, and a leading online talent assessment platform for recruitment and hiring processes.
Good evening, everyone. So first of all, my co-panelists have almost covered the whole area, and I have to leave some space for the secretary because his words will be the words of wisdom. So I've got 3-4 minutes to speak. So let me address a couple of points based on couple of reports that we do in India. First of all, let's differentiate between fertility and fertility rate. Fertility is going nowhere. It means till infinite will keep producing babies, and till infinite years it will be there. The fertility rate is declining, and the reason for fertility rate declining is largely one or two. One of them is in each country, if you looked at Japan and China and a couple of European countries, the demographic dividend they have captured, each country would undergo close to 40 years of demographic dividend. It means that there will be an acme. China acme was 2020. It means now the decline has started. If you recall, till 1980s, from 1980s, Japan had moved up. So till 40 years, they would have this acme, and then they will start declining. So first of all, India till 2050 will have an acme. So it means we will keep producing great amount of productivity, great amount of GDP. India is going nowhere. Second, what will happen if Japan productivity fertility rates go down? Nothing will happen. So what happens is every 100 years the same country would move up. So what will happen is a cycle. So if you look at every country's cycle, let's take two countries, Japan and China, you'll see by 2080 or 85, such countries, the fertility rate will keep on declining, and with each fertility rate declining, two things will happen. One, the productivity will grow, as Dr. Ruchir had shown one of the slides. Why does this happen? Because less people but the work productivity increases. So do not correlate between work productivity and declining population. Lot of us might think about that. The second thing is, what I'm more challenged about is not AI or not technology. I'm more challenged about what happens when fertility rates are decreasing and AI is coupled with hardware. It means humanoids or robots will come in. So if you have only AI, so we spoke to almost 13 companies last year. We asked them, and these are customer facing companies. We asked them, what does AI do to you in terms of manpower? So now this year they are hiring 13% less people in customer support. This year we asked hardware companies, how much robots are you going to use in your warehouses? One of the large multinational is an e-commerce company. Almost 14% workforce they have reduced in the warehouses. So it means that productivity will increase, but humans will not be employed for that productivity. So when you look at a macro figure, you will see that, oh, less number of people and almost similar or more productivity, this country looks great. But when you look at a per person productivity, it will look very high. But when you look at a unit value of absolute value of the person remuneration coming to this place will be low. So that's the second challenge. The third one is what's in it for India. If you look at top 10 countries, out of where Indian skill demand will be phenomenally high in next 10 years, and especially to 2030, there are 4 countries where fertility rate will go down and Indians will be looking at those jobs where skills are important. 6 are from Gulf countries and couple of Asian countries. Now what does that mean? It means if the fertility rates go down, technology will take on to that productivity and skilled humans will be required. For example, you must be hearing in all forums that Japan, they need healthcare workers. What does it mean? Who is a healthcare worker? Why can't a robot do the healthcare job? Because there are certain factions of Japan that what they need is something called a language and empathy. They're saying you should have language proficiency to talk to people in the healthcare industry and you should have empathy. Now these are the 2 things. Till 2040, the humanoids will not be able to compete with humans. Now, my last, but just I'm trying to wind it up, is first of all, do not get fearful of shrinking population globally because it's time for India. Next 15 years, India is going nowhere. India is going to capture the world in terms of skills economy. And believe in me, we would be the skill capital of the world. What does it mean? If you look at 4 of the major Gulf countries, majority of the today, Ministry of External Affairs, if you look at how many laborers, because there's something called ECR, immigration check required. So if you are an unskilled or a semi-skilled labor, you have to go for an ECR. 2023 data says that 400,000 ECRs have been logged. It means 400,000 people have gone from India to outside in the ECR category. And 640,000 people have gone for which are not under ECR. So my thinking and the data what it says is that India for next 15 years would produce a phenomenal amount of skilled labor. And when I say skilled labor doesn't mean only in the blue collar job, I'm talking about white and gray collar jobs. And we have to be only mindful that we have to produce people which are internationally acceptable, they are certified, and they are in the need, in the places where we are finding at least till 2080, the fertility rates are going down. So it's India's age, and let's bank on the country, let's ensure that we become the skill capital of the world. Thank you.
Thank you, Nirmal. Finally, it is my honor to invite Shri Atul Kumar Tiwari, the Honorable Secretary at Ministry of Skill Development and Entrepreneurship, Government of India. He's also the Chairman of the National Council for Vocational Education and Training, an IAS officer from 1990 Karnataka cadre. Mr. Tiwari has previously served with distinction in the Ministries of Urban Development, Overseas Indian Affairs, Rural Development, Textiles, Information and Broadcasting. Over to you, sir. Thank you.
Good afternoon, everyone. Sanjeev ji, for very briefly but pointedly you introduced the topic, and Professor Ruchir Agarwal, of course, he gave us a whole view right from 160,000 years back till the present. Aloid Bhatia, of course, always ready with figures and bristling with ideas. And he left the salvo also at the end. We'll reply to that. And of course, Rajiv Gandhi ji, he went through all different ways that the Japan and China and demographic dividend or window which we have. And of course, Nirmal Singh ji, I mean, are you a professor, by the way? Okay. So Nirmal Singh ji also for giving a very fair idea of the situating the topic very well. I don't know what to say because the discussion so far has been so widespread and in different sectors that as a serving civil servant from central government, I don't know what to touch and what not to touch. But I would like to answer as much as I can within my limitations, which is that the ministry which I had and where I have a role to play. The fact of the matter is that there are a lot of things which are there for all us to see and we are seeing every day. As Mr. Gandhi was saying that it appears counterintuitive at now to think that India's population is declining, but at the same time, Honorable Prime Minister in his different addresses to us has also asked us to do something about the aging population and how the population will decline, and already the Niti Aayog, Dr. Paul, there's a team working on having a strategy on how would we do about the aging population within our own country, for that example. Second thing is that, as has been rightly pointed out, if you see the incremental capital output ratio, and Professor Rangarajan of the economist par excellence, he has been writing and telling us that how we are not getting the adequate growth in the manufacturing sector. And while the productivity is increasing, we also find that the commensurate the labor force is not increasing. So it also points to the fact that which was also evidenced, which Mr. Gandhi was saying, that in the warehouses, or Nirmalji said, in the warehousing in India also the more and more, the trend is towards getting more and more robotics and less reliance on the people. The GCC is also a factor to be considered, and since I am from Karnataka cadre, I was very happy when government of Karnataka announced a special policy for GCC in terms of giving them investment. And as Aloit Bhatia ji was saying, it's a very, very good example of how using the technology we create the skilled workforce right here in India without bothering about the passports and the ECR and ECNR and the xenophobic interest that the outside world has at different times. So maybe there is some future at that side as well. Then we also find that we also need to increase the women participation, but at the same time, sooner or later we'll also worry that, like the other countries have done, that our children, all of us, at least in my peer group, we find that our children, even though they're getting late, they are not marrying. And that's a huge problem we are also facing, all of us must be facing, that well-educated, good earning, but not marrying, and the children will come much later. So we are also going through that phase of human society, which has happened in Japan and China and elsewhere, where we'll find less and less reluctance to marry and have babies. And so if you're saying at the same time that, yes, we need to increase more women in workforce, at the same time, you also want fertility rate to increase, so they appear rather contradictory, but at the same time, we have to find some ways of doing this. Putting all this together, there's a different way that the government, as a policy level, would like to think. And it is here that what role the skill ministry would do, what the industry we expect them to do, and our industry partnership will require is where I would like to say a few words and then close my oration or whatever. The fact is that India is also India is also a country where you find people right from the pre-agricultural civilizational state to the modern stage also. So there is also the range is quite different. Southern India, the population is declining. Northern India, it is going, and that will create a different tensions. And the internal migration, nobody talks about the people from north, labor producing states going to the labor consuming states. and the inherent the problems which are having. This is also something which is very evident, and very few of us even take notice. And then we have the gig economy and the platform economy, in which the people, more and more people are going for a very informal kind of workplaces. And the way the new age technology is developing, the workers and working place are also changing, which we have seen for the post-COVID. It's a very, very amazing and very dizzying variety of things are happening in our country, in our economy. And it's not always clear that which one to take first, because all of these are interrelated. But all of these things converge on one point. And that is what was mentioned by Nirmal Singh ji and other speakers, that we have a window during which our population is growing, and till the 2040 or 2050, there are different estimations. During this time, there will be a situation which comes once in a millennia, where India will have more young people than the old people. And this is where what we are doing. That is the point. All other things will keep on going. The technology will be changing, AI, robotics, climate change, Ukraine war, everything will keep on happening. At the same time, we have a huge cohort of the young people who need to be placed, who need to get employment, and we need to harness their energy and expertise and bring them to the economy so that the productivity increases. So what are the things which are happening? And that's what I'm saying, that how the skilling and the labor employment becomes so important at this point of our life. When more than the infrastructure, which we're talking about the physical infrastructure, roads, etc., we're also thinking about what we should do about the human infrastructure. And what are the steps that the government has taken? I would say that in this regard, the Honorable Prime Minister has been very prescient. And when he has said 2-3 things which he had said, one was India to become the skill capital of the world, very prescient, as was told by Nirmal Singh ji. Second thing, do we need to give our youth not only education, but skills? Not only skills, not only education, but both. And third point, which he says, the lifelong learning, in which there is to be skilling, reskilling, and upskilling. These are the 3 mantras which he has given to us and to all of us, and that is where all the things would converge. When we have a young cohort which is waiting to be there, then how do we make them employable, keeping the different trends and different levels of development in different parts of India? We have very high-tech industries also coming up, and very low-tech people are also coming up. So how do we manage all of them? It means that we have to go with all our guns blazing, you know. While we are doing for the AI and green energy and the green hydrogen and the new technology things, a lot of things are happening in the PLI, etc. At the same time, we also have to see how do we increase as simple as women participation rate in the rural economy, how do we increase the disposable income from the non-farm activities, and knowing that the manufacturing is going to be difficult, what policy changes which we bring about. And it is here that you will see that this year budget, a lot of emphasis is given on the skills and employment. And for the first time, we have something called the Employment-Linked Incentive Scheme, in which the government is coming forward and saying to the industries, please take manufacturing, please take women, please take new recruits, and this is a share that the government would like to bear. This is the first time that is an acknowledgement by the government that there is something in which the government and industry need to work together, and the industry also needs some incentive. Whether those incentives are enough, whether the industry will really come forward and do it, whether there are the economic conditions which create new industries to come up. There's a lot of imponderables on which one, like in government policies at a macro level, we have to give it a chance and shoot in the dark and see that whether it will lead to some result or not. Similarly, we have something about the internship scheme. We have millions of the college graduates who are whiling away their time for want of opportunities or guidance or whatever. They come from a very, very indifferent kind of education system. What we're doing them, then you have the internship scheme is there. You have how do we create the labor force for the manufacturing industry? So we have the ITS system, which we are going to, which has been announced in the budget. We are working overnight how to bring the industry and state governments and central government in 3:2:1 ratio. so that we create the aspirational level of skilling centers, not the IT which we have thought of, but something much better and aspirational which has not been tried so far. So that is our ambition which we are trying to do it. We are also trying to give some loans for the skill loans, education loans and all that. These are the policy things which are going to happen, and this is what internship scheme, of course, that is where the government is coming forward and saying that let them work in your company for 1 year, and let's see whether they can learn something and make them more useful for the economy. But whether all this thing will work. Behind all this, what is happening is also there's something which very few certainly very few in this room would have taken notice, although it has been said many times, which is about the national education policy. And the national education policy recognizes that the biggest problem with our young people is the kind of education which they get, and there is a need for that education to change for better. And that can change for better if it is done in a systematic manner, which is done in a manner where they also get the vocational education and the kind of stigma which is being attached to these skills and working with hands, colonial mindset which we all have, where the degrees are being given privileged over the working on the hands, etc., where the professor will always be considered higher than the plumber, as opposed to the OECD countries where the plumber gets more money than the professors and he's more busy. That kind of thing, that shift has to take place in our mindset. And that's why the Honorable Prime Minister has often been saying that we have to do something more relevant to the honor rather than the degree. And we realize, we are seeing, the way our education and skill has been brought not from the labor, but it's become as a part of the education, school, and work continuum, that the skilling is there. And for that, whether it's a national credit framework, national curriculum framework, changing the way education is happening, the UGCs, they are sending guidelines, the AICT changing their guidelines, apprenticeship-based degree programs, the school and colleges the colleges particularly being given 50% flexibility in having the skill courses, etc. So we find more and more colleges and other such institutions, higher education institutions, are coming forward to integrate their normal education academia with the skill requirement of the workplace. And it's here that what you are not going to see now immediately, because there is something which are going to a fundamental change in our mindset. This is what is happening, will take a lot of work has happened in this regard. Maybe sometime we'll get another session we can explain to you that what all that has been done as making the APAR ID, that the technological background, credit framework, how these things are being added here and recognized there, and what kind of certification is there, and how the academia and industry participation should increase. And this is something which I am seeing. I have been in this ministry for almost 4 years, and this is what I am seeing now, that there is a general recognition that skilling and that part, the human resource in development, is very, very important. It is not only related with education, it has to be relied, combined with the skilling part. It also has to combine with a proper assessment system. There has to be some OJT, there has to be some industry connect, there has to be more and more, whatever we are teaching or either in the skilling or education has to be in line with what the industry is doing. The skill ecosystem has developed quite a lot, which can be taken advantage of, and the industry, academia, and the government, they need to work together, whether it is the micro-credentialing we are talking about, whether the skilling or digital hub we are talking about, whether for small credit which we can talking about, whether it is a cluster-based skilling program we are talking about, whether we'd like to work with different ministries and industries, allowing them to come and work forward and skill their workforce, whether it is the employment-linked incentive scheme which the government is giving, or whether the ITIs which we are trying to change, or whether the skilling loans which we are trying to do. There is no thing which will be left unturned so to see that the government allows these conditions to emerge right from the fundamental to this long range, medium range, short term, so that we are able to create and give opportunities to our existing workforce, which, as has been pointed out, 1.5 million every year need to be added to the workforce. The industry and economy also have their own problems. Not every industry can grow more and more people if they want to increase their productivity. So what is the gain we are trying to do it? How we are trying to see that there is also an emphasis on the reskilling and upskilling part, and how all of these things work together based on the fundamentals of the national education policy, the IT prowess which we are going to have, digital system which we are going to have, their recognition, their assessment, their acceptance, working with industry and academia together. That is where the real situation and challenge would lie. So my answer to the question today will be, humanity without humans, not possible. That if there is no human, then what is the humanity, right? Second, even though there is a population are going to shrink, and there are a lot of things which we are trying to do with the sending our Indians abroad. And one of them is, as was mentioned by Nirmal Singh ji, etc. There is something called Migration and Mobility Partnership, which the India has signed for 6-7 countries. How we recognize, align our skilling standards with them, how do we assess them? That's a difficult task which is going to happen. And even for the areas such as the nursing or home care or health care thing also, especially we have seen in respect to Japan, language is a big issue and which we need to tackle as soon as possible. And there also the language also needs to be seen as a kind of a skilling requirement rather than something which is not recognized so far. That also we are trying to do it. The Skill India International Centers which have been announced, which we opened already 6, and how we are working with Lohit Bhatia ji and their group together so that we see what kind of skilling requirement, mobilization support which is required by the industries and the companies to get the human resource forces, also the government can chip in. So in the end, I will say that this is a very challenging and epochal moment for India as a country. We have a demographic window, and all that could be done for the help utilize this window. The onus doesn't lie only on the government. The onus lies together with the industry as well as the academia, and all of us working together, taking advantage of all the situations which are there, and all kinds of measures which are required, incentive-wise, pressure-wise, system-wise, compliance-wise. Everything needs to work together. So there's one single issue which is facing India, is how we allow our young cohort to be productive, useful to the economy, and that is where the challenge lies. And that is the solution of all that we are talking about, is that this is the time to act, and every day is very important for us. And this is where we would like to work together with the industry captains here and all the speakers. And thank you, ladies and gentlemen, for patiently listening to this drivel of mine. Thank you very much.
So thank you. I think we've run out of time, but I do have one question, and I'd love for all our panelists to throw a number at this. I recently read a paper, and this is really from a global perspective, that in 150 years, we will be down to 2 billion in population. What is the ideal population of the world? We've talked about overpopulation, we've talked about decrease in population. Just a number, a quick number in terms of what do you think is the ideal population? So I'll start with you. What do you think is the ideal population of the world?
Very difficult for me to answer. One hand, you're saying that we have so many people on the road, and then we find the people are not there in the factory. So what is the ideal? Lohit, aap bataiye.
Currently, the world has about 8 billion people. It'll probably top at 10 billion and then start to decline. That's what you're alluding to. But it all depends on which lens are you looking at. If you're looking from a Korean lens, it's already overpopulated. If you're looking from an Indian lens, I think we can have some more population. But I think the important fact is, and jo Atul Tiwari ji ke presentation mein nikal ke aaya, let's use the window to become rich before we become old.
Interesting.
No, you should say staffing federation हिसाब से कितना होना चाहिए.
You have.
Yeah, the most important message for a growth perspective I had was more people means more ideas and more growth. So a big risk for the world is if we go to a world of 5 billion or 2 billion, we just will have fewer people to innovate, and that will have a huge impact on the rate we will grow. And so the last thing in my slides was that if one possibility to fight that is if we have generative AI, which substitutes scientists to create science. And we don't know if the future of AI will be simply reorganizing existing human ideas, which is very bad sign for that world, or if we have a world where actually we can create new ideas, which humans would have never come up with. And then we can live with much smaller population and still the humanity can continue with fewer humans. And that kind of is the main question in front of us, I would say.
Thank you. Anyone else wants to take a dig? Or, so can I open it up to questions? Anyone has any questions? I think we'll take 2 or 3 questions. We're out of time, right? Vivek?
Just wanted to ask how brain drain can be controlled or it can be reduced still after working lot on skills and lot of growth.
I would say that the basic idea of brain drain is almost 30, 40 years old concept. Now the idea is of the circular migration. And the way the other countries are raising their immigration walls, etc., and the way the GCCs are growing in India, but still there will be need for the people to go there. So there are 2 countries. One is sending countries, one is receiving country. So it has been found that this kind of a movement of human beings, skilled if they are, is useful for both the sides. But it's more useful when those people return back. And that is the concept which should work. And it's very difficult to say that there is a brain drain or something like that. And if you see the phenomenon, what is happening within India. So I would say that we should try to create conditions that our people are going there, earn, learn, and get back to India.
Yeah, sir, the prime reasons for reduction or the decline in the population is said to be the rising costs, the costs in raising the children and also the work-life balance, all these things. So is it the human greed which is at the back of all this that has brought to this situation?
Look, humans are 99% the same as chimpanzees, as I said earlier this morning. And so we should be honest about who we are. So I would not say human greed or anything. Our goal is to take that 1% and make sure we can accentuate the good we can do with that. So if it took one person to create the mRNA vaccine, which everyone in the world benefited from, whether it's brain drain or not, it does not matter. And our goal should be to find those people among us who can contribute to the world knowledge and India's knowledge and make sure they have all the resources they need to advance the frontier and take advantage of what you call greed to make people do what's good for them, but also good for the world. So that's how I would characterize or respond to your question.
The lady on this.
Thank you. I'm Kanika. My question is to Mr. Atul Tiwari ji on the internship scheme that we are reading nowadays. So how do you plan to link this internship scheme back to the employment? So once the people are done with their internship, how does they enter into the labor market and the job things? And secondly, it's a more interrelated question is that, because you also look at the entrepreneurship side, and do you also think to connect these internship students to the startups who are looking for these kind of people to much more large extent than the existing companies? Is there any plan on that side?
Very difficult question, I must say. Thank you for asking difficult question. The point is that the internship scheme is designed so as to give an opportunity, a window to the young people of a certain defined age group. There's a lot of exclusion list also there. So they get an experience of working with the real work-life situation in different companies. And there has been a tremendous, there's a demand side and supply side, and a lot of companies have given a good demand. And we have generally, where design it has been kept that it is not to give employment. It is to make them employable. That is what the education does. That is what the skilling does. And the companies themselves, they also understand, see a value in that. And they also see as part of the CSR activity what they can do to make these young people get a work type experience. So that is limited objective which has been kept. Yes, at the end of the internship, which is being done by the Ministry of Corporate Affairs, they will also get some kind of certificate of participation and all that. But whether it will give them employment, whether it will lead to them some skill level, that as we go ahead, we'll be able to take a view. Now the pilot project has been announced, 1.25 lakh people. It is in the operation, so we'll come to those points sooner or later. Second point is entrepreneurship. Certainly all different agencies of the government are working so that the avenues of internship are told to more and more people. So you find there are people from ITIs, polytechnics, high schools, graduates, everybody has applied for that. And whether they will come with startup or entrepreneurs, so that itself is a big debate, ma'am, because what do you mean by startup and what is the entrepreneurship? Although they appear in a same category, but they are different concepts altogether. So yes, some of them may like to go to the startup as well.
Thank you. So if there's no other questions, I'll wrap up the session. So, you know, I want to thank each of my panelists. It's been very enriching for me personally to listen, you know, to this topic, because for me, what's really top of mind always is longevity. And, you know, I always talk about living till 100 years. I have 4 children, and so I've added my bit to the population. But I want to live till 100. So that's the other end of the spectrum where I'm, you know, going to be an old person and need looking after. But I think it's interesting to, you know, I don't have any more contribution, but I have things that we should think about. You know, is the cost of children too high? It's the right question. And very recently I read a dialogue with the most active user of X, who also happens to be the owner of X, you know, talking about the fact that is the cost of children too high? The advent of robotics and AI, and this is something that we grapple with every single day in our own businesses, because AI does make our businesses more efficient. You know, we're in manufacturing, and no matter how we look at it, we need to start reskilling people to do different jobs altogether, because AI is going to take away a lot of the jobs of people in robotics. That, you know, the video I showed you, we're not far away from robots. I think the number says that by 2030 we'll have 1 billion humanoid robots, which means a lot of the jobs will get taken away by robots, and we're not ready for that from a population perspective at this point in time. However, it is going to happen, so it's a reality, and that's something we need to think about in terms of, I don't know if we go to universal basic income or whatever that may be, but what that may look like, but it is true. And then, you know, addressing the aging population, you know, a topic that's extremely important today. There's not enough being done about the aging population, or enough to address it. And then more women in the workplace, and flexibility of women to work in the workplace, including women working at night, women working in different jobs, etc. Again, a very important topic. And finally, you know, employment is linked with consumption. And the more employment you have, the better the consumption cycle. And I think this is something that's so important. And when I look at this topic, and when I was asked to chair and moderate this topic, and I thought about this topic, and now I listen to the speakers, is coming something completely new to me. I'm from manufacturing. We don't really discuss this a lot. I almost feel like this is like the EV discussion we were having in our living rooms 5 years ago. This is going to become a topic that we're going to continuously discuss, because it is a problem as well as an opportunity. So thank you all, you know, for your time and for your comments, and it's been really, I'm grateful for it. Thank you. picture.
Thank you. May I request Mr. Sanjay Kapoor to present a token of appreciation to the speakers, please. And may I request Ms. Shoma Banerjee, Deputy Director General, to present the appreciation token to Mr. Kapoor. Thank you, ladies and gentlemen. With this, we close this session. You may please join us in the Darbar Hall for the session Unlocking the Potential of India's Agriculture. Thank you.